tempting, isn't it?
Oh, no, I know. Don't put temptation my way. Right, good evening, members. Sarah, do we have any... Oh, I better read out the introductory remarks first.
Yeah, I'm just waiting to get this on. Sorry.
Was that Sarah?
Yeah, I'm just waiting to make sure that's...
Isn't it?
Yeah, it's on there.
Oh, no, I
That's
know.
good.
Right, we cooking?
Yeah, we're cooking.
Lovely. This is a meeting of the council which is being held remotely. The meeting is being recorded and streamed via YouTube, where members of the public are able to watch the meeting. Please note that any comments posted on the chat feed of the council's YouTube page during a meeting of this meeting will not be monitored by the council. The recording will be available on the council's website following the meeting. All members have been provided with remote committee guidance note prior to the meeting. Please can these be adhered to during the remote meeting. Points include mobile phones should be switched off or set silent. Please switch your profile to mute unless you are speaking. If you wish to speak, please raise your hand. For each item, officers will present, and yeah, you know the rest. Right, Sarah, do we have any apologies for absence?
We have apologies from Mandy Skeet.
Thank you. Declarations of interest. I think for myself and Councillor Henry, best declare we're both members of Essex County Council as well as Basildon Council. Councillor Schrader, you indicate to speak.
Yes, thank you, Chairman. I just thought I'll declare an interest under item 9, as I have a flat on the Langdon Hills estate, and that's referred to in on page 62.
Well spotted, Councillor Schrader. Are there any other declarations of interest? Fine. Then we shall go to the agreeing of the minutes of the Housing and Communities Committee. I will split these into two points first. Are there any comments about the meeting held on the 24th of November? No. Are there any comments made on the meeting held on the 2nd of December? I see that as no, so I shall take a vote on both minutes at the same time, unless there's an objection, and I see no objection. So I shall read you alphabetically. Councillor Golden, how will you be voting?
I'll vote in favour of the minutes.
Councillor Henry?
In favour.
Councillor Rimmer?
In favour.
Councillor Schrader?
In favour.
Councillor Yacoub?
In favour.
And I should be voting in favour. Then we go to item 4, Housing Development Subcommittee, meeting held on the 9th of December. Is there anything that members wish to pick up with those particular minutes? I take that as a no, so I shall again call members out alphabetically. Councillor Golden?
I vote in favour.
Sorry, Chairman, just to interrupt, we don't need to vote on those, it's just a note for the development. Thank you.
Right, now, item 5, we have Ben Hughes here to give us a presentation on drug and alcohol treatment service, which I would imagine, with these sorts of last 10 months, they've been stretched to new limits. Mr. Hughes, you have the floor.
Many thanks, Chair. Apologies, I'm not used to Zoom, but I'll try not to mute or disappear. And I believe, Paula Mason, I think you are going to share your screen for me.
Yes, hopefully everybody can see that.
Have you shared it? Have you shared it, Paula? We can't see it yet.
Yes, I've shared it. And we even practiced this.
No, it's not on there at the moment. Have another go. Try it again, Paula.
Yeah. Is it there?
No.
Click on share screen at the bottom, Paula, yeah?
Yeah. I'm doing exactly what we did.
There we go.
Got it? Yeah.
Yeah, it's there now.
Thank
There
you.
now. So could you put it on view on presentation mode, Paula, so that the slides are as big as people can get them? Oh, that looks better. Can everybody see that okay? I'll take silence as a yes.
Yes.
Good evening. My name is Ben Hughes. I'm one of the heads of Wellbeing and Public Health at Essex County Council, working within the public health function of Essex County Council. As you can appreciate, the last 10 months have seen us slightly well employed and certainly busy. dealing with certain issues that have cropped up. And as somebody mentioned prior to the presentation, many of the services we commission have been significantly impacted by the current COVID crisis. So I was asked to look at presenting the scale of the issue in Basildon, what is commissioned here, what the future is looking like, and what the impact of COVID-19 has been on the delivery of services as they exist in Basildon and indeed across the rest of the county. Next slide, please, Paula. So the drug treatment system that we monitor our treatment services through is the National Drug Treatment Monitoring Service, and it does not report data at a district council level. However, we are currently in the process of developing new reporting mechanisms in the information technology system that we currently use, the web-based case management system called Theseus, to enable us to look at reporting at a much more granular level. So that going forward, we will be able to report to the 12 districts about performance and also treatment numbers. However, you can see that during the year 2019 to 2020, there were approximately 466 individuals who received formal structured treatment through the services that we commission in Basildon. What you can see from the two graphs that I have been able to produce from data that we do collect at a more local level is that for Basildon, the rate of alcohol-related admissions to Basildon Hospital has significantly increased over the last couple of years. In fact, above both the England and the Essex average. However, the drug deaths related to drug poisoning rate in Basildon is actually lower than both the England and the Essex rate, and you can see that following a sharp increase from 2007 to 2013, that we are starting to see that figure coming back down again. We have relatively low levels of drug-related deaths in Essex as they relate to the national data and national averages, and Basildon has a relatively low rate of drug-related poisonings. However, as you can see on the alcohol side, there is an issue with regard to admissions to hospital for alcohol-related conditions, and that is the broader definition of alcohol-related conditions, and that is conditions of health that are impacted upon by long-term consumption of significant quantities of alcohol. So what do we commission in Basildon to support those that present to treatment? Next slide, please, Paula. There are a number of services commissioned by Essex County Council Public Health Function, and you can see those in front of you. The budget that we have to commission drug and alcohol services has been impacted by national reductions in the public health grant. Over the last 5 to 6 years, my budget has been reduced by 35%, and we have managed in most cases to mitigate the impact upon frontline services by reducing the size of the commissioning function and also some other associated functions as they relate to substance misuse. So we have managed to soften the blow where it relates to frontline provision. However, across Basildon, you have Choices, which is a service provided by Open Road and the Children's Society, which is an all-age recovery management service. And this is the service that is the front door for our treatment services relating to drugs for all age individuals across Basildon. And they will provide psychosocial and counselling low threshold interventions. They provide the harm reduction initiatives such as pharmacy-based needle and syringe exchange. They offer services that liaise with the youth offending services, and they provide young people support, advice and mentoring services in relation to substance misuse. We have also recently recommissioned the alcohol services, and the front door alcohol services are now provided by an organisation called Phoenix Futures, whose contract started pretty much just as COVID struck. So whilst they have done huge amounts of work embedding themselves across the county, they have been significantly impacted by COVID, but they provide, again, recovery coordination and harm reduction with regard to alcohol, psychosocial and counselling interventions for those presenting with alcohol services. They also provide an A&E liaison function within Basildon Hospital to support A&E in relation to identifying frequent flyers and regular attenders of A&E and getting them referred into further services to support a reduction in their alcohol consumption. We also commission across Essex, and it is available. They work in Basildon, a service called Futures in Mind. This is a collaboration between Phoenix Futures and Mind, the charity, and is jointly commissioned with my mental health colleagues. And they provide befriending and mentoring provision, peer-led diversionary activities, and recovery support to individuals both in treatment and once they leave treatment. And they basically coordinate, develop, and deliver whatever it is that the community feels is most appropriate to support individuals to maintain their recovery and prevent representation into treatment. We also commission services from an organisation called Action on Addiction, who provides 2 community rehabilitation services across the whole county, one in Wickford and one in Braintree. These are both available and accessible to everybody in the county and basically provide a residential service provision without the pyjamas. So people attend on a daily basis, 6 days a week, for an intensive professional psychosocial intervention, and it is more than simply just a day program. It is an intensive psychological program that replicates what is provided by residential treatment, but it means that people can stay within their local community and remain at home wherever possible. They also provide high threshold psychosocial and counselling interventions to people whose needs cannot be met by either Choices or the Phoenix Futures Alcohol Project. Action on Addiction also delivers something called the Moving Parents and Children Together programme, which is a family intervention supporting families where addiction is impacting upon children's well-being. The last but one service that we commission are the specialist medical services. These are commissioned from the Essex Partnership University Trust, the mental health trust across Essex, and they provide specialist substitute prescribing, home detoxification and rehabilitation management in the community. They also are the gateway through to residential and inpatient services where those are clinically assessed as being suitable and required. They also have a parental and family substance misuse liaison function and work with children's social care, where parental substance misuse is impacting upon children's well-being, where the child is known to, or the family is known to social care. And EPUT and the Specialist Treatment and Recovery Service also provide the specialist hospital alcohol liaison nurse who operates within Basildon Hospital, supporting the hospital in the acute setting to work with individuals who are in hospital as a result of alcohol-related issues. We are currently working with the CCG across South and Mid Essex to look at enhancing this provision, because there's a recognition, as you saw from the numbers that we've seen, that there is a growing need for more interventions to be placed within the acute setting. Additionally, and beyond the pure substance misuse services, we also commission a service called Full Circle, again provided by Phoenix Futures. And the Full Circle service is a service delivering to offenders with complex and additional needs. So individuals both in the community and in prison, or those leaving prison and returning to the community, whose needs are complex and whose care needs to be coordinated across a range of provision, namely mental health, housing, employment, substance misuse, and often a broader range of compounding issues that if dealt with effectively can impact positively on their reoffending. They also conduct Care Act assessments in HMP Chelmsford for social care. So as you can see from this, there is a significant range of provision, And all of these providers are contractually required to operate together and jointly as a system of provision to ensure that wherever need is identified, it can be provided for. This has all been impacted by COVID, and much of the provision now has had to go from face-to-face to online and virtual interventions. However, many of our services have still retained, wherever necessary, some face-to-face interventions. Next slide, please, Paula. So getting into treatment for alcohol, drugs and alcohol, whilst you can see on the screen there are two clear routes in for alcohol and or drug referral. Our system operates a no wrong door philosophy. If a client rocks up at any one of our services, they will be welcomed in and assessed and referred onto the most appropriate solution for them. They will not be sent further down the road, because we want to harness that moment of motivation when somebody steps up to be supported and to seek help with regard to their drug and or alcohol provision. But these are the two key agencies, key organisations, and these are the two routes in should anybody want further information. Next slide, please, Paula. Over the last 2 years, I've been working with Essex County Council members and the community to look at developing something called the Essex Recovery Foundation. It has long been seen and evidenced nationally and internationally that care in the drug and alcohol world can be improved and made more effective if service users and the community are at the core and the heart of planning and commissioning drug and alcohol treatment services. So with the permission of Essex County Council Cabinet, we founded a charitable organisation called the Essex Recovery Foundation that has a board comprising professionals from within the industry and also service users, carers and families. And the intention is long term that this charity will both manage the commissioning of drug and alcohol services across the county and also seek to lever in additional resources, additional funding that obviously as a statutory organisation Essex County Council cannot do. The charity is chaired by Marcus Roberts, who was previously the Chief Executive of DrugScope, a national charity. And as I say, there are a number of service users, carers and family members on the board and the Recovery Advisory Committee. Currently, the Essex Recovery Foundation are working with health, criminal justice, local authority and other colleagues, and linking across into Southend and Thurrock to look at developing the next 5-year drug and alcohol commissioning strategy to ensure that the needs of the community are being met more effectively. And they are currently in the process of submitting a number of bids and submissions to grant makers and funders for additional funding to enhance the existing services that we have. And the intention is for the community to lead in partnership with wider stakeholders on the commissioning of drug and alcohol services in Essex. Final slide, I think, Paula. So how has COVID impacted on delivery? All of our services have continued throughout the pandemic. At last March, when all of this started, we implemented a series of weekly meetings, virtual meetings with the whole system to ensure that all of our services were being provided in line with the guidance that was being developed by the government and in line with the needs of the community and those presenting for treatment. All of our centres follow government regulations and are COVID secure. However, this has had an impact on the capacity of the service to engage with all of those seeking help. And we are currently in the process of enhancing the provision with money that has been provided centrally to reduce the impact of COVID on services to vulnerable individuals. Face-to-face delivery, whilst I say in the slides there has been replaced with telephone and video call options, there has still been the provision of face-to-face appointments where clinically it is vital that those services are still provided. However, over the last couple of weeks, we have started to notice, in line with the increase in COVID cases across the county, that staffing levels are being impacted by the actual virus now being seen cropping up amongst the staff group that are providing the services. So we are looking at ways that we can mitigate this impact and hopefully see our way through to actually continuing to provide the level of services that are being demanded. We have agreed with the NHS that the providers of substance misuse services are vital frontline services, and as such the staff are being prioritised for the vaccine along with social care and NHS staff. Any questions? That was a whistle-stop tour.
Thank you for that, Dave. I just want to pick up on something before I hand the floor over to members. I saw from the start of your presentation that Basildon's the second worst in the county for alcohol addiction problems, and whereas the rest, and Basildon's probably the second least worst borough in the county when it comes to drugs. So is that an income-based problem where alcohol's infinitely cheaper and far easier to purchase than drugs?
I would suggest that the alcohol-related issues are those of accessibility, yes. The drug-related death issues are those of are down, and the reductions that we're seeing in drug-related deaths has been the result of significant amounts of work by my team and the services that we commission to look at the learning that we are getting from investigating drug-related deaths. We are seeking additional investment from the NHS in the services that are provided within hospitals, but for alcohol services. But to be brutally frank, alcohol services have always been the poor relation.
Yes. Right, I can't see all members, so if I just call you out alphabetically if you wish to speak. Councillor Golden, did you want to speak on this item?
Yes, I got a few questions. I'll
And
throw
before
them
you
in.
go, the next speaker will be Councillor Henry, then Rimmer, Schrader, and Councillor Yacoub.
I'll throw them in clumps of three. So the first sort of thing is around data, and sort of what data points are you sort of currently grabbing, where you're getting your data from to inform commissioning, and do you have any plans to sort of expand that and look at other areas of data? So, for example, we've heard at health board before that refuge collectors noticed a vast increase of people recycling glass bottles. So is there any scope for more targeted interventions if we notice an increase in perhaps people drinking? Second question is around what's being done to look at quality improvement in terms of I know there's a 5-year strategy. I mean, I don't really like 5-year strategies. I think that's too short, but that's it is what it is. So what are sort of the ambitions in terms of quality improvement, and what are some of the key performance indicators around that? Moreover, how are we using service users, people with lived experience, to inform that quality improvement journey, and what are some of their views perhaps? And finally, in terms of apps where you can, at a touch of a button, order alcohol to your property, you don't even have to leave your home. What is being done in combination with perhaps our licensing boards across Essex to try and clamp down or at least address some of the challenges around booze being able to be delivered to your front door very easily and very conveniently? So yeah, I've got a few more questions after that, but I think that's probably a good start for 10 perhaps.
Do you want me to answer those before we go on to the next, Chair?
What we're going to do is go through each member. So if you can deal with Councillor Golden's first set of questions.
Yep, no problem.
And he'll have some more questions for you.
So as I mentioned at the beginning, Councillor Gordon, we look at the National Drug Treatment Monitoring System. That is a collection of data points or of data across a huge range. I think there's something like 260 fields in the NDTMS, which looks at all of the data of all of the people presenting to treatment. So we have all of the data about those who are both presenting and in treatment. We also work with the police because we've been working to look at developing the drug market profile across Essex to look at where drugs are accessible, how much, what drugs, what's being used, what current trends look like, how we can intervene in the market. We work with health colleagues to look at hospital episode statistics, as is mentioned there with regard to the admissions for alcohol-related conditions. So we look at alcohol and drug hospital episode statistics, and we work with primary care and our CCG colleagues to look at presentations at primary care around drugs and alcohol. We do work as closely as we can with community safety partnerships, but you'll understand there's me and one other member of staff, and there are 12 district, borough and city councils across the county. But Paula will evidence the fact that we do, wherever possible, try to engage with community safety partnerships and look at things like antisocial behaviour and hotspots around those sorts of issues. So we collect vast amounts of data, and we have a 3-yearly cycle of conducting a needs assessment, strategic needs assessment across the drug and alcohol field, looking across all of the data that we have and also identifying where there may be data sets that we are not currently accessing that may be useful to us. And with regards to lived experience, as I mentioned, we have formed the charity, or I have formed the charity with that explicit aim in mind, that actually it is no longer a bureaucrat, me, in an ivory tower commissioning services that I think are useful, but we are going to be ceding responsibility to the community and authority to the community for those with lived experience to identify what works, where it works, and what needs to be commissioned. So we are in effect handing over that responsibility, albeit tentatively and slowly, because it is a bit of an experiment, to those with lived experience to research and assess whether or not that is the most suitable way of taking things forward. With regard to quality improvement, we carry out an annual audit process against a series of quality audit standards that have long been designed and developed within the drug and alcohol field, and we audit our providers against a set of audit criteria on an annual basis. So I think 2 years ago we audited their responses to drug-related deaths, because we were starting to see the increases that you can see in those graphs. And I think a lot of the learning out of that developed the quality improvement that we saw across the services that saw us actually being able to turn that curve. So we take quite seriously the issue of quality improvement, and one of my team is a clinical specialist around quality improvement, and is in fact a prescribing pharmacist by trade, and she is continually working with our service user population to look at developing the quality audit process. With regard to the availability of booze, I think it's widely known that drink is available wherever, whenever, and however you want it. And where we can, we work with licensing. Public Health are a statutory respondent to licensing applications. We do not currently have the capacity to engage effectively across the county, but I am developing some of that capacity, and a member of the Public Health team is going to start when we can actually get out the back end of this crisis. He has been tasked to start looking at working with licensing across the district, borough and city councils to look at how we can more effectively respond to licensing applications. Does that help?
No, that's really helpful to hear. I think one of the things I would certainly good to hear is that there's a plan to work closely with our licensing committees, because I think that is, it's not necessarily, booze is always going to be available. Yeah. It's, that it is what it is. I think one of my concerns is I said that the apps that are coming forward, where you can just press a button, you haven't got, a shopkeeper or a pub landlord sort of providing an interface point. It's just a delivery driver knocking at your door.
Yeah.
And I wonder if perhaps there's some scope for maybe some creative working. Maybe we could bully some of these apps into giving us some funding. I don't know, but anyway. But final set of questions, probably quite easy ones. Firstly, in terms of the Care Act assessments, I'm interested to know who does those. So are they social workers? And how much weight do they hold within the local authority? So in terms of the commissioning part, if this organisation goes in, does a Care Act assessment and says, I don't know, they need a domiciliary care package, you know, someone coming in twice a day, who honours that? Secondly, in terms of, is there sort of a single point of access for any drug or alcohol related referrals? Is that sort of, or a virtual single point of access? That sounded like that's what you were describing in terms of there's no wrong door. And finally, in terms of, I'm not an expert in this, so I'm going to be led by you, Ben, in terms of sport. And is there any scope, and perhaps you already are, building bridges or working with the local delivery pilots in terms of ensuring that service users have access to sport? And is that a viable way of helping people, supporting people out of addiction? Because I think that's something that is quite important in Basildon. Yeah. So that's it from me. Thank you.
Okay, Care Act assessments, the ones that I mentioned are the ones that are done in prison, because we have a Care Act responsibility for prisoners whilst they're in Chelmsford Prison. The initial assessment is carried out by Phoenix Futures, who then refer on, once they've carried out the initial assessment, which is almost a triage, they then pass on to the community social care teams, who will go and do a full Care Act assessment and will then refer that prisoner on release back into the county, into the care package that they require through social care. So that is a managed process of identifying social care need for individuals whilst in custody. Where it is a general need for social care in the community, all of our services work very closely with adult social care and will refer individuals in for full Care Act assessments where that is necessary. With regard to access, the two access points I identified in the slides are the other sort of key access points for people to get into service. They can be accessed through telephone, online, or in person when we're allowed to. But as I say, all of our services, wherever they are, operate a no wrong door policy, and we'll welcome people in. With regard to sport, I mentioned Futures in Mind, which is Phoenix Futures and Mind operating a sort of peer support mentoring program. They are working really closely with Jason Fergus's team, Active Essex, and are linked into the LDB program. But actually also Futures in Mind have developed boxing clubs, football clubs, cycling clubs, all sorts across the county. And Futures in Mind, if you identify a group of service users that want something, Futures in Mind will come in and help those service users build it and develop it. So it's not about them doing something and then telling the community it's there. It's about finding out what the community want and helping them build it. So for instance, in another area, not in Basildon, a group of service users wanted to set up a metal detecting club. So Futures in Mind came in, bought them 5 metal detectors, gave them use of a minibus and a driver, and took them out metal detecting. So they wanted it, we built it.
Thank you so much for that, Ben.
Right, now we've got our normal screen. I'm going to stick to my plan. So next, I'm going to call out, if he wishes to speak, is Councillor Henry.
Thank you, Chairman. Nothing from me. That was a fantastic presentation. Thanks to Ben and Paula. I'll move on to the next one, Chairman. Thank you.
Thank you.
Councillor Marshall, I'll never get into you with a gunfight. I saw how quick you unmuted yourself. You have the floor, Councillor, if you have any questions.
Very wise, Chairman, very wise. In respect of this report, now again, I echo fellow councillors Henry and Gordon in respect of it, and thank you for this presentation. It's very helpful to see. It's good to see that the drug deaths themselves have actually seemed to have stabilised over the last couple of years in both Basildon and Essex wider. It's shocking to see the alcohol emissions going up through the roof. I just want, obviously these are two different sets of data that we're comparing. Obviously we're not looking at alcohol deaths versus drug deaths. I mean, have we got anything on drug admissions? Have we got anything on lower touch points in respect of drug use in terms of drug driving, for instance, where that gets picked up versus drink driving, and obviously is symptomatic of a problem. So that was one of my key questions. And the other question was, what can we learn for the sort of in-between levels where alcohol and drug use is a problem, where it's not an acute addiction that's leading to either hospitalization or leading to death? What about those people who have become functioning alcoholics, functioning drug addicts, or at an even lower level, people who notice that they're drinking more than they usually should and becoming and becoming more unhealthy as a result, and actually are in slower decline, but in decline nonetheless because of it? And just if there's any sort of lessons that can be imparted, any sort of collateral that we as a council can use to aid and help people at this time, that'd be useful too. Thank you.
We have, with regard to the alcohol-related hospital admissions, whilst Basildon does stand out as a sort of bit of an outlier, we have actually, and this is going to sound like a bit of a sort of mealy-mouthed explanation here, but we have managed to slow the rate of increase of alcohol-related hospital admissions. They were flying, and in by putting in the alcohol liaison workers in the acute setting and in A&E, we have in some part managed to slow the rate of increase, because the graph a number of years ago would have looked a lot scarier even than that one. And now I think what we need to do, and we're trying to work, we are working with our health colleagues to look at building the capacity in hospitals, because it does work. It is shown to work. It has been shown to slow the rate of increase. What we now need to do is actually turn the curve and actually reduce the rate. So we are working with colleagues to look at trying to increase that capacity. However, that comes with a need to increase the capacity in the community, because if we identify people in hospital and we're going to refer them into the community, we need that additional capacity there. And that's one of the sticking points, because we simply don't have any more money. And I know I'm not unusual in saying that. I'm not the only care group that's that could claim a lack of funds, but we are looking at how we can do that, because I think you're right. I think yes, we were looking at two different fields. We don't actually look at alcohol-related deaths the same way as we look at drug-related deaths, possibly because nationally it's not collected in that way, and possibly because it will be too scary. With regard to drug driving and other indicators, we do look at data from the police with regard to drug and drink driving. Drug driving has been on the increase, but it is not a significant issue. Now, that could simply be a result of the way it is policed, and the way that police officers engage, and you can identify somebody who stinks of alcohol. It is a little more difficult to work out if somebody is actually over the limit with regard to either recreational or other drugs. With regard to lower level engagement, we do work quite closely with primary care, and wherever we can, we try to provide primary care with training and resources to deliver things like identification and brief advice sessions. So in the alcohol field, for instance, it's been shown that a 10-minute brief intervention with somebody who has presented with another issue, so they've either rocked up at their GPs because they're feeling depressed, or they've fallen over and smacked their face because they've been out drinking, a 10-minute brief intervention using an identified methodology does have an impact on somebody's drinking. So we do work quite closely with primary care and other professionals to deliver identification and brief advice. There is also a website that we have. It used to be easy to find on if you search "Don't Bottle It Up," and it enables you to take a test to see how your drinking is affecting you. I would welcome any feedback on what people's results are there, because I've done it a few times and I've tried not to do it over Christmas. But it does actually give you a very clear identification of how your drinking is going to impact upon you, and it also gives you advice around how you can look at reducing your drinking, replacing drinks with soft drinks, etc. So there are some lower level interventions and lower level support available out there. And Choices and the Phoenix Alcohol Service both engage with individuals who are not technically addicted. They provide services to those who are worried. They provide services to families who are worried about a family member. So if a family member rings up, they will provide support to that family member without having to see the individual who they are concerned about. So I hope that helped.
Councillor Rimmer, you have the floor.
Yeah, just one quick one, Chairman. Thank you, Ben, for those answers. It was also just to ask about apps. If there would, I know that I've heard of apps being used as well for people to keep a drink diary and other nudges as well. Is that something that you promote as well? Yeah, the Don't Bottle It Up site has a range of applications that you can use, that you can download onto your phone. We do have something called Breaking Free Online for drug clients, which is an app and a website that Open Road will promote with their clients and promotes more widely. And I am trying to work. I'm working. It's very difficult finding in the public sector, finding really technical people who can help you. I've got this idea that saw something in America from a company called Trigger Healthcare, and it uses artificial intelligence and machine learning, and you download the app onto your smartphone, and your smartphone learns your behavior, and it can predict relapsing behavior. And it's been shown to be about 92% accurate in predicting relapse. And if it predicts the relapse in the user on the user's phone, if it will start sending positive reinforcing messages to the client, and it will also send an email to the care or to the treatment center for the care worker to get in touch with that client because they may be at risk of relapse. It is an American product, and it is incredibly difficult trying to find people who will help me develop this in the UK.
Councillor Rimmer?
Sorry, I may be able to help you with that, Ben. I have some contacts in that space. I will send them over to you via email.
Please do. That will be really useful because it exists. The technology exists. It's just finding somebody to do it.
Thank you, Councillor Rimmer.
Thank you.
Councillor Schrader.
Thank you, Chairman. And I think in common with everybody, I'd like to thank Mr. Hughes for his very comprehensive and interesting presentation, and obviously pass our thanks on to his team for all the work that they're doing. I think I, like everybody, have been alarmed in particular by the stats around alcohol, which surprised me, to be honest. I wouldn't have thought it was that. The difference between that and the drugs thing, I probably would have thought was the other way around, but it makes sense now that you're sort of spelling it out. I don't have anything really to add beyond what's already been asked by colleagues. We've covered a lot of ground. I just wondered from your point of view, because obviously it's almost like too much to take in one bit, but from your point of view, in terms of the specific problem with alcohol here in Basildon, what do you think, if funding wasn't an issue, what is the one intervention or policy that you could put in place that you think would make a big difference that you can't presently do for one reason or another, be it funding or whatever?
If funding wasn't an issue, I would like to increase the availability of low-level interventions around both street drinking, but also lower level interventions around non-addicted but problematic drinkers. If policy was at my fingertips, I'd look at minimum unit pricing, because I think whilst it's not the silver bullet and it's not an answer in and of itself, it has been shown to help as part of a wider range of interventions. Yeah, I think more funding. I mean, we've been trashed. We are currently in the process of working through the Dame Carol Black is nationally reviewing the drug and alcohol field, and I'm actually on the expert panel nationally for that, probably because I've just been around for a long time. And one of the recommendations going to government was a significant reversal of the funding trends around drug and alcohol treatment because of the wide-ranging impact of drug and alcohol issues across a range of other social issues. So, for instance, I'm also the Rough Sleeping and Homelessness Prevention Commissioner for Essex, and during the crisis, we've obviously had to try and house all of the rough sleepers, and the vast majority of the rough sleepers are presenting with drug and/or alcohol and/or mental health issues. And it's difficult to work out whether the drugs, alcohol, and mental health have caused the rough sleeping or vice versa. But the prevalence of drug and/or alcohol issues impacts so widely, and it is short-sighted to cut the budgets. But then that's my political moment in the sun.
Thank you. Councillor Coo, do you still not wish to speak? Oh.
I just had one question. Thank you for the presentation. I wondered if you could elaborate on what a low-level intervention would look like, and in terms of addressing the causes behind drinking, because I know you're doing work around mental health, but you can restrict access, but you might not be able to then work on the root cause for why someone feels the need to drink to that level. And a lot of the times it is, even if it's not serious mental health issues, there are issues there that need to be looked at. And I'm just wondering how that's kind of addressed in these low-level interventions.
Most of the low-level interventions that we commission are those that are involved in looking at very low-level mental ill health and/or social functioning issues and grief and bereavement. But also looking at adverse childhood experiences. So it's looking very much at picking apart the current using behaviour, but actually also looking at the causes and the root causes of those issues. Very few people start using drugs or alcohol to become an addict. Very many people start using drugs or alcohol because they're fun, and many of those people who start using because they're fun invariably pull themselves out of or never end up in problematic use. The ones that end up in problematic use are invariably those that are using as a result of some sort of adverse childhood or adult experience, or some sort of low-level depression, anxiety, grief, bereavement of some sort or another. So we have very good links into significant high-level counselling with regard to grief, bereavement, mental health, and other experiential presentations. But the low-level interventions are very much about those sort of lower social functioning issues and around the ability to cope. So they're very much around solution-focused therapies that look at building people's coping and coping abilities.
Thank you. Councillor Henry, you want to ask one further question?
Yeah, sorry, it's really a follow-up from Councillor Schrader's questions around your funding. What sort of funding would we be talking about in terms of being able to attack some of those low-level issues? For example, if you were to put together something that was specific to the alcohol issues that we have here in Basildon, what sort of funding would be required to maybe just get a start on that?
I think you'd be looking at probably 2 workers, so less than £100,000 per annum.
Okay.
Would give us a good start at building capacity at that lower end to do a lot of the work that we used to have with regard to detached, peripatetic and domiciliary outreach work.
Okay. Sorry, Chairman, can I just follow that? Are there any other groups that you could maybe set some projects for to get some of this started with? You know, some of our local charity groups are great within the healthcare market. You probably already work with some of them anyway. Are there any ways that maybe some funding could maybe help them get some projects off the ground for you?
the problem at the moment is I don't have any money to do that. But I mean, broadening the sort of base of the pyramid is probably one of the most useful things to do around low-level drugs and/or alcohol. So actually engaging with that, with the sort of the smaller, more local charities, is something that both Phoenix Futures and Open Road, and through Futures in Mind that we've done. Much of the work that Futures in Mind has done with regard to developing some of those diversionary activities has been about engaging with local, very grassroots charities. They do actually, Futures in Mind do have a small community pot that they've been able to support some smaller charities to do things like delivering food to the rough sleepers, and building some of those networks and harnessing some of the networks that already exist. So yes, there are ways we can do it, and I think Futures in Mind is a really useful way to start that one for the drug and alcohol world, simply because they do have a small pot of money available to develop some community interventions.
Thanks, Ben. Thank you, Mr. Chairman.
Thank you. If you're rather quick, Councillor Emma, I'll indulge you.
Thank you. Just talking about the pyramid again, do you do anything with schools? And also, just in respect of employers, is there any sort of interventions or any sort of partnership with employers where they notice work patterns changing for staff as a result, possibly of alcohol or drug misuse?
Yeah, most of our providers will advise workplaces with regard to drug and/or positive drug and/or alcohol policies in the workplace, and some of the work that goes on in workplaces. We do have Job Centre Plus staff operating out of all our drug and alcohol services, so that there is engagement through the employment agenda. With regard to schools, and Paula will know this only too well, we commission an evidence-based behavioural programme in schools across the whole of Essex called, go on Paula, what's it called? Risk Avert. There is a program called Risk Avert that we have spent a huge amount of time developing, that is a risk behaviours program delivered in primary and secondary schools. I funded a PhD to evidence its efficacy. We fund annual evaluations into it, independent evaluations through Bath University and Essex University, and it is seen to improve self-efficacy and build resilience in vulnerable young people. It is not just a drug and alcohol program, because just drug and alcohol education does not work. There is no evidence to suggest that sending a drug user into schools stops young people using drugs. However, what we have been able to show over the last 6 years with Risk Avert is that it builds resilience, builds self-efficacy, and improves young people's attitudes to risk, including drugs and/or alcohol. So that's my pitch there. Got that in, Paula?
Well done.
Lovely. Thank you. Are there any other non-members who wish to speak? No. Right, Mr. Hughes, thank you for your presentation tonight and answering the many various questions you've been asked tonight. It is appreciated. You're very welcome to hang around while we move to the next item of business. I should go to item 6.
Would it be, Chair, would it be okay if I left now, Chair?
You're very welcome to stay, leave.
Thank you very much for your attention. Thanks for the questions, and let me know if there's anything else I can help with.
Thank you so much, Mr.
Thank you. Cheers. Thank you.
Thank you.
Chairman, is it okay for me to leave now?
As you're one of my constituents, I dare not argue with you.
Thank you. Bye-bye.
Thank you, Paula. Take care. Right. I shall know. Anyone else want to go? Won the lottery? Wishing to sub themselves? Speak now, forever hold your peace. Right.
I think Councillor Gordon wanted to leave. I think that's a reasonable request.
Everybody wants to leave. Anyhow, we'll go to item 6. Request to Essex County Council for match funding for BAME books. This is just an update. I'm sure members have read my rather nice letter on pages 33 and a very helpful reply from Essex County Council where they've match funded it with a further £1,000, which I think is great. I'm assuming Councillor Goop, would you like to make any points, questions, or any other members? Go on, Councillor Emma. You have the floor.
Thank you. I mean, it just shows what collaboration is possible when the two authorities work together for the betterment of our community. It's great that from the chairman and from the committee to have actually committed this money, and it's fantastic from Essex County Council to match it and see it in the context that it is. And actually, it was even better when reading the letter to see their further commitment to equality throughout the county, and in particular their recognition of needing to do more for the BAME community and the additional material that is being looked at throughout all the libraries throughout Essex.
Thank you, Councillor Rimmer. I'm guessing no one else wishes to speak. And all I would say on that point to wrap up, it proves the point. If you don't ask, you don't get. But most of the time when you do ask, you commonly don't get. But that was a good thing. No, brilliant. Right, now we're going to go to this new thing, which Grant, I believe, is leading on, the draft Connected Communities Policies. Or is that you, Leslie? Oh, here we go.
No, it's me, Councillor. Sorry, I was trying to get myself off of mute. Thank you, Councillor. Let me find the report. So, thank you very much for inviting me once again this evening. Yes, I've come to speak to you tonight about some work that we've been doing over the last year with the basis of developing a new policy called our Connected Communities Policy. This follows on from much of the work that's been going on within the organisation over the last year, certainly within the realms of our community response to the COVID-19 pandemic. As members will know, officers have been at the heart of running the Basildon Community Hub, which has seen us relating and engaging with many partners. We always do that, of course, but I think it's probably fair to say that our engagement with a wider range of community sector partners and our insight and engagement directly with communities has perhaps never been as high as it has been this year and continues to be. And I would say that whilst again always had strong relationships, our relationships and partnership working certainly with the voluntary and community sector has never been stronger than it has been over the last year. Clearly, the impact of the virus continues to have put a huge strain on many of us, and I speak as members of the communities ourselves, be those mental ill health or physical health issues, combining those with increased levels of concerns with regards to employment, financial sustainability, and of course just being healthy from the virus itself has of course had an effect on the strength and resilience of ourselves and our communities. And I think that's obviously the case way beyond Basildon's borders too. That said, as a community leader, Basildon Council continues to play an active role in leading and identifying ways in which it can support, contribute and influence the development of community connectedness and the work we do with our communities. And this policy looks to set our footing for the ways in which we can do that perhaps better. What the policy sets out, as I'm sure members would have read, is 3 key focus areas, and I won't go into them in too much depth, but of course we'll happily answer any questions. But in essence, these are connected neighbourhoods, so how we directly work with our communities and the way in which we do that. And this is obviously, of course, all based on the learning and the listening we've done over the last year and what we've known for many years with the work that's been going on in our community development team and wider afield. About our role in being in a connected council, how we connect better with our communities and the role and competencies that we place and on that, and the work that therefore we should be doing to connect better and connect well. And thirdly, having connected partnerships, which I guess I was just speaking about earlier. How do we make sure that these partnerships and this kind of although we would never want to be in this situation with regards to the virus, some of the green shoots have been this strengthened relationship and strengthened partnership working. How do we make sure that this isn't just the remit of or just in play whilst we have this public health crisis and it becomes the new normal, I guess. So should the committee approve the policy tonight, this will be followed by a strategy will be developed as to how we will bring the policy to life. And of course, if that would be the case, we would come back to committee to get that agreed. Consultation activities with key partners and communities and partners from across the sectors will of course take place, and the strategy will be backed up by a delivery plan, which we'll co-design with partners for how we will deliver that. Our intention, should the committee approve the recommendation this evening, which is that the committee approves the adoption of the draft Connected Communities Policy 21 to 26 as set out in enclosure number 2. We would like to come back to the committee quite soon with our strategy, looking at the March meeting, because work is very much underway with the premise of what the strategy might look like already. Thank you very much. I'm of course happy to answer any questions.
Thank you, Grant. As always, quick draw McGraw, Councillor Rimmer, you have the floor, and then Councillor Cope.
Thank you, Chair, and thank you, Grant. And just obviously, there's quite a bit of quoting of the Marmot article, empowering communities, and it's obviously that's making comparisons between Aboriginal communities in Northern Australian and looking at England in terms of education levels for local authorities, looking at Baltimore, looking at Malmo in Sweden, where I know that the leader went to actually investigate what goes on in Malmo. So there seems to be quite a few ideas coming from Malmo in this respect. But that aside, I'm just curious to know, because obviously they're looking at a range. In Northern Australia, there were 29 communities which were widely spread, and seeing how and their connectivity in that respect. I'm just wondering how you envisage that working in respect of the borough of Basildon, where we're all quite close together. I'm just wondering how you see this policy working in that respect, and what the comparison is. And I'm wondering, as a second question, if we're being ambitious enough, if we're looking too much to what's been achieved in other places, and an article from about 6 years ago, and actually we should be looking further ahead than that in terms of what sort of change we would like for Basildon as a borough, and look to other international examples.
Carl?
Thank you, Councillor. Well, I mean, first of all, the work of Professor Marmot is very important. It's much of it's been based in the UK. I mean, of course, there are a number of Marmot cities up and down the country now that have taken the learning of the Fairer Lives process. Although Mr. Marmot is an Australian, he obviously worked very much for the British government for many years. I think whilst that is quite empowering work, the report has not been written on the basis of that. I think we've utilised the words of Marmot as perhaps one of the chief thinkers in this field, nationally and internationally. The report, the policy has been very much written on the findings of ourselves, our partners, our staff in Basildon in particular, and that is very clear, I think, in the policy. We're very, very hopeful that we can build on some of the work that we've certainly seen during the COVID pandemic. So as you'll see in the report, it advocates the work around kind of digital inclusion, which is something we've absolutely witnessed as during this pandemic, and have done much work on trying to understand how we overcome that, and been successful in drawing down funding from Sport England and other places to be able to do some work in and around that. And I know that the council's now writing a sister digital inclusion policy. It talks very much about the importance of that kind of place-based village mentality work. It's been absolutely abundantly clear to us that during the COVID pandemic, where communities have stepped up and done so much positive work. They've really focused on their own areas, the areas that they call home, that they understand best. And I think it is probably fair to say that a lot of the work we've done previously from a community level is focused on us as a borough, but communities are very much galvanising around the very small local places. So we've started to do some work very much with regards to opening schools up, for instance. How do we make those hubs within the local communities where we've got great facilities, etc., the places where more people go and do stuff? So you are right to pick up on that part of Marmot, but I can clarify, Councillor Rimmer, that the report's not been written based on that national or international guidance. It's more just using that as a springboard for the discussion, if that helps.
Go on, Councillor Rimmer.
Yes, certainly. Thank you, Chair. And thank you, Grant. I mean, one thing that Marmot does put in there is obviously when he was looking at education, and he was looking at how you do increase educational achievement in deprived areas compared to to wealthier areas. He was talking actually you tackle the deprivation. And I'm wondering, are you relying on the strategy to actually come up with areas that need to be tackled to actually get the outcomes that you want? Or should we have seen it at this level? In terms of this, I know this has been born out of COVID. I appreciate this, but my nagging thing in my head here is obviously this policy is supposed to at least be setting the agenda for the next 5 years or so, at least, maybe 10. Have we made this future-proof enough? Have we actually centred far too much on COVID? Hopefully a problem that could be vaccinated away in the coming months.
Thank you, Councillor. So I hope not. I don't think so is my truthful answer. I think what we've seen rather than COVID is that when community get a bit between their teeth about something, where they galvanise around something that they have a shared interest and a shared passion for, magic happens. And I think that's what the report is trying to do, and being able to work more in those kind of micro communities, localised communities, focusing our efforts much more on those areas where we can therefore unleash that potential. I think that's what we're trying to do. The report talks about proportional universalism, so the concept of being able to take a borough-wide approach, but with only finite resources. Sometimes we have to spend our resources or influence partners to be able to put most efforts into the areas where it's most needed. So I think that is the process we're talking about. When you talked about, I guess, the deprivation type of thing, it is very, very difficult to spread ourselves thinly across 185,000 residents. But we obviously, of course, want to make sure that we're impacting across the board. But to do so, we might need to focus the partnership working efforts of ourselves and many of the other groups that I know you all know that the council are working with into some of those localities where I guess where that energy is and where that opportunity is.
Very, very quick question, because we've got a big agenda still, Craig. Councillor Rimmer.
Yes, thank you, Chair. Proportionate universalism was one of the oxymorons that we identified in the report and the actual policy itself. One thing, we had to look it up and look at the definition and kick it around a bit to understand it, if we're honest, and so is there a case really? I mean, I'm minded to pass this grant. I'm not going to get, pedantic about these things, but shouldn't we actually be trying to make these things clearer to understand for the average person on the street, or even the average councillor?
Do you know what, Councillor Rimmer? You took the words right out of my mouth with these oxymorons.
Very happy to take that feedback, of course.
Right, thank you. Councillor Coombs been patiently waiting, then Councillor Henry, then Councillor Schroeder.
Thank you. As you know, I'm part of the COVID working group, and I think this is a brilliant policy. It's really needed. I'm very much on board with it. I love the stuff around having an open council and enabling and empowering communities. I just have a couple of questions in terms of how it would look like to make council offices more accessible to people. Because at the moment, it's very much a case of councillors are the kind of front face of dealing with residents' concerns, residents coming with things they need help with. And I think that works well in terms of, you know, having a counsellor to go through. I mean, it's not necessary that they go through a counsellor, but in terms of like representation and having a counsellor as the advocate for what they need help with or what they deem important. And I think with this idea of making council officers more accessible, I would like to understand how that would practically look like, how that would work, even in terms of like safety of council officers. I have a couple of questions. The other one's around the point on village mentality and neighborliness. How is something like that, in a way, like quantified? How is it measured? How do we know that's working? And also around the point on identified barriers. The report doesn't go into much detail on that. It's not kind of clear if there is a list we're working with, how we're identifying these barriers. And I'd also like to know if this work will in any way complement other projects like the Inclusive Basildon Borough project, or even like the Basildon Side by Side. How would these different projects complement each other? Yeah, I think that's it.
Grant?
Thank you, Councillor. I mean, with regards to that access and availability of officers, I think that's part of the challenge, really, because I think as officers, we do pride ourselves on that accessibility, but if we're not reaching the heights that communities need or want, then I think that's what the strategy needs to develop more, and that's what we're looking for the remit tonight to be able to go away and do. I think what would be really helpful, Councillor Cube, is to work with yourself and perhaps other councillors that want to help us develop that piece of that particular process. I think that would be the way forward with that, because as I say, I don't think that there is a view that officers are hidden. I mean, it's obviously been a very, very difficult year with regards to doing face-to-face work, but certainly as someone that manages a service where, you know, even today, a good 60% of my staff are still working on site every day. You know, we are very open and accessible. But I think it is clear that perhaps we're not. That's not the view everywhere, and I think that again is part of being able to kind of work more within the communities themselves. And I think when I mentioned earlier about opening up schools and the like, and being more available, I think that's some of the ways in which we'd like to do it. I know that, for instance, we've done some work with Leslie and her team previously, whereby we've taken housing advice specialists out into schools, so once kids drop their kids off at school, they can go and get that support on their doorstep rather than having to travel into Basildon. I know we've done work where we've had the community development officers doing kind of surgeries in different localities in the past and stuff like that. I think we'd like to be able to standardise much more, but it's also about our partners as well. So how do we get the CAB into these micro communities where they most need to go and stuff, and that's what some of the work we're trying to do there is. So I hope that helps at all there. The village mentality neighbourliness aspect, I mean, that very much has come from some of the work that we have. I guess we knew it, but it really got heightened during the pandemic. As I say, we were seeing incredible stories. We were all seeing incredible stories of how communities have stood up and helped each other, knocked on neighbours' doors. Do you need anything? Really, really simple kind of neighbourliness stuff. And what was really clear from the conversations we were having with volunteers via Motivated Minds and other parties, and also the social listening that we were doing, was that people feel really empowered about helping their communities. But previously, for whatever reason, they weren't doing it. There was no reason not to do it previously. But how do we make it the norm? I mean, obviously, I've got John McKay in the corner here. John always did things like that, but not everyone is John. So we know, how do we grow more Johns? And I think that's a really important point. And that's why, and I think John, I don't know, John is an example of that. John very much galvanises and focuses on his community, and he drives a lot for Lee Chapel North. And I think that that mentality of my estate, my area, has a lot of credence with people very clearly, and we saw that quite a lot. The mutual aid groups were growing up very much around kind of more micro areas. So that's what we want to do, is to build from that. With regards to identified barriers, the report tries to set out how we can get more partners working in local areas, how we can help tackle the digital divide. That digital divide is very clearly in relation to low-income families, children and older people. That is therefore, there's a twin piece of work being done on digital isolation, as you'll know. So there are a number of ways in which we're trying to do that. But again, I think the strategy is the part that will really pull that out. And then finally, on your final point about how this links in, the team have obviously worked with partners across, with inclusion diversity team and the like. I'm very proud to say that I sit on the side-by-side group, so certainly I've been able to help input into this policy some of the learning and the thinking from side-by-side, and again, I really think it's the strategy, the things we're going to do should this policy be agreed, is where this will really come to life. And it can't happen in isolation of those places. So it will need to be co-commissioning with side-by-side, co-commissioning with the LDP, co-commissioning with the Creative People and Places funding or programme, co-commissioning with the community development work and the funding streams that we're running, etc. I think that's the way we hope for it to work and to influence the council far and wide, rather than being just something that the very small communities team does in isolation. Thank you.
Thank you. Commissioner John Mackay, did you want to come back, as you was mentioned?
Yeah, certainly would. My biggest problem is that, as you know, all community centres are shut down. But all community centres, there's been a drain on their resources week by week by week. We still have to pay all the necessary bills that come in. So my problem is, other community centres that are shut and non-running, will they be able to function if COVID was to stop tomorrow? Because, you know, while we're paying gas, electric, rent rates, insurance and all that, that's all coming out of the coffers. At the end of the day, there's going to be an influx of loads of people that want to come in and do groups. But if the community centres is not up to scratch, or people have walked away from it for 18 months or whatever it is, you're not going to get this. All right, probably schools are all right because the kids are going. But my biggest gripe is, Grant's sitting there. I have never had anybody from day one come to me from the council and said, how can we help you?
Grant?
It's only me going to them.
Right. Okay. Well, I will. My understanding is certainly our community development officers had worked with you over a number of years, John. Certainly Michelle Fairchild.
I'm talking from March. All right, Michelle. I speak to Michelle on a regular basis.
Yep.
Because she's now a friend. But when I need to ask a question, I go to her. But that aside, you've got all these other groups, the community hub and all that. No one from day one has come to me and said, how can we help? How can you impact? We did at the beginning, and then we had it thrown in our face. So we've actually shut the door for months because we weren't getting nowhere. And my biggest problem is that this year has been, there's only me and Pam working there at the moment.
Yep.
You know, the food bank is flat out. I'm collecting 7 days a week for our community. There's a stall out the front, but no one has ever come up to me and said, how can we as a council help you? You know, and I'm going back, you know, and I've had Gavin at the door, I've had the mayor at the door, I speak to Kerry on a regular basis, but no one's come up and said, how can I help?
Grant, going offline, can you make arrangements to speak with John?
Yeah, of course, anytime.
Time. Thank you for that, Mr. Mackay. I had Councillor Henry indicating to speak next.
Yeah, thanks, Chairman. Thanks, Grant, for your presentation. I think one of the issues I think a lot of our residents have is pathways and being able to identify where to go for the help. I think it's out of sheer frustration that a resident will pick up their iPad or their iPhone or whatever and write to a councillor to ask what should be a fairly routine thing. So I think in terms of making the council more accessible for residents, I think we should have much clearer pathways. But specifically to this community work and some of the other subjects that we've been talking about, we have always been able to rely on the people of Basildon and Langdon and the other towns within the borough to really pull together when the chips are down, when there's something going on, when there's some god awful things happened or befallen the local community or the neighbours. They may not necessarily be, round your house for a cuppa every day, but when the chips are down, Basildon people pull together, and they really do come together as a great community. And I think it would be a real crying shame if we arrived at a point in time where COVID is no longer a conversation, it's no longer a daily thing. John's got his community doors back open, all the other centres are back open, and we let people drift back to lives of isolation and loneliness on their own. I think we've got to do all we can to engage people, but more importantly, to get them to tell us what matters to them in their communities, rather than us have an ideology of what we'd like to achieve with some cross function working. I think there's a real great opportunity. We know in Langdon in particular, we're a trappy lot up this end of the borough. If you ask us something, we will tell you. So I think there's got to be a good bit of engagement work to try and work out what it is that people want, and more importantly, what they don't want. And I think the moment this starts to then get like a task, as in, God, we're all doing this for you, it's like, well, why are we paying council tax? You should be doing this. I think we've got to really get the balance right between how we get those people and keep them involved in the things that they've really taken a pride and a passion in. We've seen so many examples of volunteers, and we've seen such great engagement work with our community leaders. John, we've seen great engagement with Carla and her team as well, and just ways of keeping keeping the services alive and keeping people in contact, because it's a peculiar world to be living on your own, and you literally come in and nobody's coming and you're not going anywhere. And if you've been to Tesco's today, that's your lot for another day. And so it would be a real shame to squander that and to let things go back to normal. And I hope we never get back to whatever normal was before. I hope we find a new normal. I'm very much in support of this, but I would say let's have a little bit more of the community telling us what the community wants, rather than us trying to steer the conversation. So that would be my thoughts on it. Thank you.
Thank you, Councillor Henry. Are those comments noted, Grant?
Of course, yeah. And if you wouldn't mind, Councillor, I'm absolutely in agreement with Councillor Henry, and I certainly wouldn't advocate taking a policy on behalf of communities where that wasn't the case. And we're trying to get through the policy now to be able to do that. But rest assured that much of what we've learned has been through that engagement, through partners, through our communities team, impacting that from their dialogue with the community. Always can do more, undoubtedly, though.
Thank you. Are there any other speakers on this item? Councillor Schroeder.
Thank you, Chairman. Happy New Year, Grant. I completely agree with everything that Councillor Henry just said, and I don't think this is a bad policy at all, and obviously it will have my support tonight. There's clearly going to be a lot of very valuable learning for the council from the engagement activities with communities that we've been doing through the community hub and so forth. And as Councillor Henry said, all the different, the way that communities have come together right across the borough, from the borough-wide things right down to the sort of small street-wide things. So I think that's certainly something that if there's going to be anything that's good that's going to come out of this pandemic, it should be that we seize this opportunity to develop a policy like this. But I don't want to belabor the point that Councillor Rimmer touched upon. But when I was reading through this report, I must admit I did go slightly cross-eyed on occasion. There is a lot of local government speak in this report, which from one local government officer to another, Grant. You know, we love this this kind of stuff, I know. But I'm thinking particularly in respect of the reference on page 39 to you know, the strategy being developed through consultation with key partners to develop the delivery plan. I just think when it comes to, you know, we need to think about who we're going to be consulting and what we want to get out of them in terms of what we want them to feed into the policy. And this is where I have difficulty with, I mean, the connected partnership stuff, I get that completely. But the stuff on page 38 did make me glaze over. And even though it is kind of explained in a bit more detail on pages 47 to 49, there's still a lot of quite, you know, fluffy phrases. So we talk about encouraging a village mentality and neighborliness. I mean, I think I know what neighborliness is, but I'm not sure I'm completely clear on what a village mentality is. Even though I grew up in a village, I'm not sure what my mentality is or how we encourage it. And then there's things like focus on place-based working. And I did also pick up on this proportional universalism, which even though it's explained a bit more on page 47, I wasn't much clearer on what on earth that means. So I just would go back to what was said earlier. You know, we need to make sure that when we're putting together a policy, I think it does need to be intelligible for the average resident and for the average councillor. And you won't find a councillor much more average than me, Grant. So if yeah, I'm quite happy to have a look at any future redrafts, and if I can understand it, then you can rest fairly assured that you know, even the dimmest person that's likely to read this will understand it if I can. So what I would just say is that I think everything in the policy is good, but I think we need to try and avoid all the sort of the managerial speak. You know, being an open council is, you know, that's great, but it's a stock phrase. It doesn't really mean anything. When we talk about breaking down barriers, such as, I mean, you know, and I get embracing digital opportunities, because I think our digital offer is much improved. Certainly since I was first elected. I think the website is much better, and you're able to engage with many more council services online now than you were before. But I think there's always room for improvement. So I think that the consultation phase will be key to really refining and honing this policy. And I think it's a very worthwhile exercise, but I think we just need to maybe try and produce a plain English version of this. Thank you, Chairman.
Thank you, Councillor Schreider. Any other comments from anybody on the call tonight? That looks like a no. So on that basis, Sarah, we're going to go straight to the vote, which is on page 37 of your agenda. I shall start alphabetically. Councillor Golden, how will you be voting?
I vote in favour of the recommendation, Chairman.
Thank you. Councillor Henry?
In favour.
Councillor Rimmer?
In favour.
Councillor Schreider?
In favour.
Councillor Yacoub?
In favour.
And I shall be voting in favour. So if we get item, and that is yourself leading on it, Grant, please.
Councillor. Okay. So next report I'm bringing is the community support funding proposal. This report follows on from this committee issuing in February last year £13,000 funding to be allocated to enable the borough to participate in the national celebrations to mark the 75th anniversary of VE Day. And then subsequently, on the 10th of March, this committee again allocating an additional £10,000 to that, specifically for the national celebrations of Victory in Japan Day and the 70th anniversary of that, I should say. Now, needless to say, there'll be no one surprised in the room to understand that due to the current COVID pandemic, the proposed way in which the borough was going to commemorate and celebrate these huge occasions was not able to continue. And of course, that was not only in Basildon, that was very much nationally. I should say that, you know, the borough participated in a way that in a positive way, with communities engaging from their doorstep in VE Day and celebrating and dressing our homes and the like. But clearly, the large scale events with the which we put the committee put the income towards was not able to continue. So therefore, the committee have an opportunity to consider how this £23,000 that's been underutilised or could be utilised or directed, I should say. And it was agreed at this committee in November last year that a report should be prepared for members' consideration. So I just wanted to kind of set out some of the work that had been done in relation to this to come back and provide options for members. There was some specific talk, as I understand the committee, I wasn't there, in relation to being able to support local food banks. Clearly, the food banks are continually doing exceptional work. They've done that through COVID and done that at previous times. Obviously, there are a number of food banks all around the borough. Through community officers, they've remained in dialogue, as we do with our county colleagues, who again are working with food banks around the county. Clearly, at this committee in November, additional just over £10,000 was delivered, and I know, and you'll see here in the report on page 54, funding that has been delivered via our county colleagues in the summer, in October, and at Christmas. And I do know that another round of that funding is on its way too, as I understand it, to support the food banks. So on that basis, with the 3 rounds of funding from county, the round of funding from ourselves, and a future round of funding coming from the county council, there is a view that perhaps the £23,000 is not best spent on that at this stage, with our understanding of where the food banks are with regards to access to food and like, although whilst totally understanding how busy they are and the fundamentally important work that they're doing. Similarly, we did some work in looking about that, how we could enhance the work of the voluntary and community sector, the VCS in the borough, who are doing, again, brilliant and fantastic work throughout Basildon and further afield, and have been absolutely key partners to the community hub. I will always take every opportunity to make it clear that Basildon Council are a partner in the community hub, and that it's delivered by any number of different groups working together. Of course, the council's taken on that leadership role, but there are many partners that have been commissioned to and have worked to it. Motivated Minds, the CVS, and many others who have been participating in it throughout. We were lucky in the fact that DEFRA, we've secured some money through DEFRA via our county colleagues of just short of, or just over £38,500 to support vulnerable communities, and that the council took the view in October this year to disseminate that funding in its entirety out to local VCS groups to aid the fantastic work that they're doing, which I think was a really important step for the council to take, to make sure that those community groups were best ready and able to support people. So funding for the VCS groups was distributed in different amounts to charities including Motivated Minds, the CVS, Citizens Advice South Essex, Sociability, Parents of Parents, Call Carers, the Craig Tyler Trust, and more. Aside from this, the council, of course, continues to support the voluntary sector with our Grants to Organisations Fund, which is healthier this year through the support of this committee than it's ever been previously, with over £30,000 available to support community groups. And aside from that, as the committee will know, because it came through this committee, an additional £40,000 has been provided to support the capacity of the voluntary sector with regards to the work that they do around mental health, and that fund has very recently closed, and we are in the process now of doing the service level agreements for those that were successful and they're being informed or otherwise. So again, on that basis, with the plethora of support that's been available and will continue to be available through the grants to organisations, but a recommendation is not being given to spend the money in that area. So moving on now, other areas of potential funding. So a number of requests for funding come through the chairman of this committee, which the committee can consider tonight. And I will identify these and help out best I can to answer some of these. So following a recent survey of a community facility in Highcliffe called Highcliffe Community Centre, which is situated in Whitford Memorial Park. Regrettably, there are a number of trees there which are causing issues with the structural integrity of this important community building, which is where a children's centre operates for early years providers. The insurers, of course, will help support the council in and have insisted that those trees come down. But under the insurance policy, what will happen is that those trees will be lopped at the bottom, which will just leave us with stumps. Now, importantly, these trees are part of the memorial trail in Whitford Memorial Park. So have all been appointed to fallen of Whitford and of our borough. And it would not be in keeping in our mind to leave stumps there. So there will be additional requirements to stump grind those and be able to plant mature trees which are suitable and will not cause the same issues from a subsidence or point of view, etc. So there's an ask of £5,000 to support that. Of course, this is quite fitting on the basis that this funding was originally for celebrating VE and VJ Day celebrations. So the work in the Memorial Avenue in particular seems apt for this. Beyond that, a further request has been made from a ward member for additional salt bins and a security gate in Pitsea, again coming to about £5,500. And the chairman of this committee has also requested wooden bollards to be installed to protect grass verges in Berry Lane, Berry Close, Witchards, Langley's, Latchet Shaw and London Road in Vange, with the estimation for the cost of that being about £4,600. So where the first one, with regards to the memorial trees, is within the remit of this committee to make that call, these latter ones are not within the committee's remit, and therefore, as you will see from the recommendations above, it is recommended that this funding is pushed to the Neighbourhoods and Public Spaces Committee for them to approve, in essence. So I will bring the members back to the recommendations here. So one, that funding is not allocated to the Food Banks or the VCS, but that the £5,000 is allocated for removal and replacement of memorial trees in Whitford Memorial Park. Three, that £18,000 unallocated funding is returned to the Housing Communities Committee for the member investment pot, and four, that it recommends that the Neighbourhoods and Public Spaces Committee to consider the investment of £10,100 in additional salt bins, security gate and wooden bollards. Thank you very much.
Thank you, Grant. Since this was published, there's been two other items brought to my attention, one by Councillor Henry and one further by myself. So I shall table that now as an amendment. We'll talk about the amendment and we shall vote on the amendment and then the overall package. So Sarah, are you ready with your pen? Right. Now, I want the £7,900 outstanding. Isn't that correct, Grant? Grant?
But how much, Councillor, did you say?
7,900?
Yep, I think that's right. I've got it on an email if you want me to check, but carry on and I'll have a look.
So you check while Sarah writes. So with the remainder £7,900, subject to confirmation of the exact location from Councillor Henry, that 2 further salt bins are purchased, and that's around £700. Councillor Henry, is it Mellow Purchase Close and Mellow Purchase End? Jeff?
Sorry, I'm screaming at my screen. Yes, please.
So we've got that right.
Yes.
So that takes away £700 thereabouts, Grant and Sarah, from the 7,900, and use the remainder £7,100 to install a seating area on Dry Street at the entrance to the cardiovascular unit, where the nursing staff are presently placing upside down bread baskets to have some sort of seat. With what's gone on, let alone normal times, the nursing staff shouldn't have to sit on bread bins during their break on Dry Street. They should be able to have a proper bench at the very least. So that's my amendment. Use the remaining 7,900 to buy 2 salt bins as per Councillor Henry's exact locations, and and to install a seating bench on Dry Street near the cardiovascular unit for our nursing staff to sit on during their breaks. Do I have a seconder? Any member like to second that? Councillor Golden, thank you. I have a seconder. So we shall debate the amendment and then vote on the amendment, and then we go to the overall package. Anyone wish to speak on the amendment? Councillor Rimmer?
Yeah, I think we'd like to make an amendment of our own, to be honest, because
we're talking about this amendment.
Yeah, so I'm speaking to it. I'll speak to it. We'll vote against it because it's futile to vote for it if we're making a completely different amendment. I'm just giving you my reasons for why I will be voting down otherwise worthwhile projects, because we believe there is a better purpose at this time for this money.
Any other speakers on the amendment? Councillor Henry?
Yeah, before this gets spent, I genuinely want to hear from John, from John himself, that he's happy that no further funding is going to the food banks from this amount. Because when we met last time, we spoke rather passionately about this £23,000 and how perhaps it should be divvied up and maybe given out to the food banks. And that was largely in part because we'd given a large sum of money last time, and we'd heard from John about how difficult a situation it was and a variety of other aspects that he'd had to face into during this time. So if it's all the same to you, I mean, I think the suggestion of this shelter, I think it's a great idea, but if it's all the same to you, I would also like to hear from John and make sure that he's happy with his funding arrangements over the coming months.
John will be very welcome to come in once members have spoken, but we're going to vote on the amendment first, and then that way all of that £23,000 is there as an allocation, so we can vote on substantively. I mean, John, you're very welcome to come in and say what you need to say.
You want me to come in now?
It's up to you.
Right, I just want to make a point. Reading your minutes, on page 54, it lists the summer fund, the October fund and the Christmas fund. We got nothing on the summer fund. We got nothing on the October fund, and the Christmas fund of 2,500 was specifically from the not your council, but Essex County Council for food hampers, which we had to spend specifically on food hampers, and we supplied over 100 £35, £45 hampers for over Christmas, over 100. And going on the funding side of it, I've got my bank statement and my accounts in front of me because I've done them over the weekend. And over the year, we've only received 3,600 from you, council. And further point is, if you was listening to the radio today about Martin Rushford, he was on about the food parcel for kids. Well, we worked it out. If we was just to do the kids alone this year, it would have cost us £25,000, which is more money than we've had all year. But we, through the supermarkets that support us fantastically, we managed to do 35,000 meals. And we are literally, I know my bank account looks healthy, but there's a lot of stuff going out this month. But we will never turn money away, because we can, with more money, we can do more. And that's the simple facts of it. You know, I'm running a motor that's going to give up. Sooner or later, that's got to go. And I don't know. It's down to you boys and girls to decide if you want us to continue feeding the people of Basildon, because since Christmas, it has gone mad. And you're more than welcome to come down. You won't be allowed in, mind you. You can look through the window, because there's only the two of us in there. But we are literally got stacks full of gear. You know, it's just going out as fast as we can put it in the trolley. I mean, I can send you photographs and everything, but it is manic. And we desperately need, if we're going to continue for the rest of the year, we need funding. And it's as simple as that.
Thanks, John. Before I invite Councillor Schrader in to talk about the amendment, I've just sent you on an email to say Essex County Council have announced a further £90,000 funding pot for food banks. And really and truly, the County Council should be putting the money they're getting from the government. Remember, Basildon isn't getting the money from the government for the food banks. It is the County Council. And the County Council should be going by need, not by some sort of calculation. Yeah. Councillor Schrader.
Thank you, Chairman. Yeah, now, on the amendment, obviously it's a bit of a difficulty for myself in the same way as Councillor Rimmer. In that respect, by doing it this way, you are making a bit of a rod for your own back, because I don't necessarily disagree with the additional salt bins, or indeed the shelter, the shelter or the bench at Dry Street. However, I find myself at the present time not in agreement with the central recommendation of the report, which, I mean, I found that the bit on page 54 where it says at this stage the overwhelming response the council is receiving is that the borough's food banks are well stocked. That doesn't jive with certainly what I'm hearing from my local food bank, and what I suspect other councillors are hearing from food banks in their wards, and from what Mr. Mackay has just told us. So, that the overwhelming resolution of this committee was to give some additional funding to the food banks, given the extraordinary, above and beyond service they've been delivering to our residents during the past year. So at the moment, I would be minded to vote against the amendment, because I plan to vote against the recommendation in the report. If we get to the substantive and we've already voted down the recommendation, then I might feel differently about the amendment. But as things presently stand, I'm still of the view that we should be giving the additional funding to the food bank as we previously resolved to do.
Right, but thank you everybody for this debate. So I should just wrap up on the amendment to purchase 2 further salt bins where they're needed. Remember that local highways panel at Essex County Council waste £4,500 on a job Basildon Council can do for £360. A lot of our key workers, like the nursing staff, live in the Lee Chapel area, and when it's icy and cold, I want to make sure that nursing staff, teaching staff and key public sector workers get out of our estates and get to work and keep our public services functioning. As a member for Nevermain Ward, which takes in Basildon Hospital, it breaks my heart seeing that nursing staff we have do everything they're doing, having to sit on uptown, damp, soaking wet bread baskets. It's a slap to the face to our nursing staff. It really is. They deserve somewhere proper to sit. I understand where the opposition are coming from, and I respect the way they're going to vote. So on that basis, we're going to vote on the amendment. I shall call each member alphabetically. Councillor Golding, how will you be voting, please?
Thank you, Chairman. I'll vote in favour of the amendment.
Councillor Henry.
Sorry, I've got to vote against.
That's fine, that's fine. Councillor Rimmer.
Against.
Councillor Schrader.
Against, I'm afraid.
That's okay, that's okay. Councillor Coop.
In favour.
And I shall be voting in favour. And Sarah, that's my casting vote used. So the item's passed. So all of that £23,000 is allocated. If I can speak in a bit of further detail of some of the items that's been put on here, is that it's been raised as items of safety concerns by myself and other members of the council because of the.
Sorry,
I don't want to sound political.
Sorry, Chairman.
Yes, Councillor,
but you've voted on the amendment. You still need to vote on the.
That's what we're doing. We're now having a debate. Thank you, sir. And we have this rather unworkable.
Point of order, Chairman.
Yes, Councillor Rimmer.
Do we need to put an? We would like an amendment on the actually allocating money to the food banks.
I did hear you, so I was just opening up on this item formally after the amendment passed, and then once I've spoken, you can propose your amendment.
Thank you, Chairman.
As I was saying. So unfortunately, we have a rather terrible arrangement through the County Council and their preferred highway contractor, Ringway Jacobs. One of the schemes is outside Vange Primary School, where we've been trying to get wooden bollards installed where people are parking over the pavement and the grass verge, which and with this social distancing, when people are parked in that manner, you cannot have the social distancing outside a very busy primary school. Now, Essex County Council told me that job alone to install sufficient wooden posts was £36,000, with the bulk of that £36,000 going in design costs and all of that money going to Ringway Jacobs. Well, we can install the posts at £200. Now, I appreciate what the opposition are saying is we're in a time of crisis. We need to support the food banks. We'll do whatever we can. We're doing everything we can. But we have to protect the public purse. Unfortunately, we have a county council that just has got a terrible arrangement set up with their highway contractor where they're literally able to muck the taxpayer. So all of these jobs we take away from the local highways panel saves money for major road traffic schemes. There's an outstanding one that's been kicking around for years in Wickford, one in Billericay, and a recent one I've just put in Langdon Hills. Now they're all around the £150,000, £160,000 mark. So if we can save £4,500 here, £5,000 there, £36,000 there, it's not long before the Wickford crossing gets done, and maybe a few years later that Billericay crossing, and maybe when I get my free bus pass, the Langdon Hills crossing gets done. So what we're trying to do is look at it holistically. What is there in the general good? So I'm going to stop at that point. Councillor Rimmer wishes to propose an amendment, and I'm sure you have a seconder. Sarah, is your pen ready to take Councillor Rimmer's amendment, please?
Yeah, so it's simply to change all of the recommendations to one recommendation that this committee does allocate the remaining £23,000 member investment funding to food banks.
No ambiguity there. Thank you, Councillor Rimmer. I'm guessing you have a seconder. Councillor Henry. He was first to the hand. Who would like to speak to that, please? You have the floor.
Thank you, Chair. I mean, I've actually had residents call me who've actually experienced quite a tough winter, to be honest with you, under these conditions. And I'm sure, and we heard from John McKay last time about actually people who haven't been used to using food banks before, who due to COVID have found themselves in a position where they are actually doing so. So there's this increased demand. And it wasn't just for food, but it was also for face masks, which this committee looked at as well. And other issues come to my attention in respect of prepaid electric keys as well, and actually people finding it difficult to actually keep the heating on because of these, because of the the situation that they find themselves in, and actually going through quite a tough winter. So it just strikes me that we need to, even if we're not going to, that we need this pot, this £23,000 to be there to fund the immediate need and any other extra need that comes about in the next month or so for our food banks. I think personally that they probably swallow it all up in one go from the sound of the actual crisis. But if they don't, and we've still got some money aside that we can actually allocate to them, that's all for the good. It is clearly the right thing to do. Now, I understand what the chairman is saying. I also understand that the chairman has access to other funds from county that he probably distributes as well as a division member. And there is still the option to co-fund projects with local organisations who don't have to use county council contractors, as he well knows. And I'm sure he's actually been very apt and very good at doing so in the past. So I understand his argument, but I don't think it's particularly relevant on this occasion for what we're actually talking about. We are actually keeping families afloat. That's what we are doing here by allocating the £23,000. We're keeping individuals, vulnerable people, afloat. That's what we would be doing here by allocating the £23,000. A lot of these projects that are being put forward are very laudable, but in reality, in comparison, in terms of the absolute emergency crisis situation that we find ourselves in at the moment, I don't see the ask as reasonable. It's clearly we need to get through what Chris Whitty said are going to be the worst few weeks of the crisis. We need to get through that. We need to do everything that we can do to keep this borough shipshape, to keep families shipshape, keep individual vulnerable people shipshape. And I will not be able to sleep at night knowing that I haven't done everything I can to actually make sure that this passes, this amendment. I hope, Mr. Chairman, because I think you're a very reasonable person, I think you could reconsider your view on this in the mindset of what we've heard tonight from John, and what we do know is the sort of situation as it unfolds at the moment, but it's a crisis that's only getting worse.
Thank you, Councillor Rimmer. Does your seconder wish to speak?
I was just winding up.
Oh, sorry.
No worries. It's a situation that's only going to get worse. And come the spring, hopefully we will be in a better place. But we need to do all we can to actually navigate these choppy waters now for our residents. Thank you.
Thank you, Councillor Rimmer. Councillor Henry.
Thank you, Chairman. I have no problem with the amendment you brought. I have no problem with the suggestions and the recommendations on page 53 at all. But where it doesn't work for me is the fact that John can't sit in this meeting and say that he's all right and say that he's coping all right. And we live around the corner from each other. John's about 4 or 5 streets behind me. You know, that's where his place is. You know, we run into him in Tesco's all the time. We know how much he's filling that car. We see it all the time. That thing is up to the roof. Every single time you see him, he's literally, you know, packed up. And every time you're on Ballard's Walk, there he is with a stall out there, absolutely running up his own butt, trying to feed people. Of course, we want the shelter at the back of the hospital. Of course we do. And I very much like these salt bins, but I'd also like my neighbours, a good few of my neighbours who would use a food bank, to have somewhere to go and to be able to get the help that they need. We are in difficult times. And I just, if John was able to say, you know what, this is it. No, we're doing all right. You know, if you look at 54, we've had 2.5 grand, we've had 2.5 grand, but he's not. He's telling me he's had 3 grand or 3.5 grand. So we need to be chasing that funding anyway. But I'm just not convinced. We can be spending this. Once it's spent, it's spent. and we've got people that are literally going to be going hungry in a time that none of us would be living involuntarily if we had our way. But you know, the whole meeting tonight has been about helping people. It's been about doing that, and I understand. But I've lived in this house for 21 years. I've not had a salt bin out there since that somebody set fire to it. So we'll manage another year, or just as soon my neighbours were fed than maybe run the risk of falling on the bum. So that would be my view. I think the work of our food banks, the work of our community groups, and really pulling together to make sure that families and children, you know, have a bite to eat and have you know, the dignity of a warm meal in their belly, and people that will treat them right when they turn up there and not look at them like they're, you know, urchins. You know, John and his group treat people with a good deal of respect, and they're never judgmental. And I think that's very, very important at this time. And I'd really really ask the committee to reconsider the £23,000 for food banks. Thank you, Chairman.
Thank you. Anyone else wish to speak on this item? Okay. Just wait for my email to stop bleeping. But I hear what the opposition are saying, and it's hard for anyone to disagree. But the extra funding we've got, because we've gone into further and further higher tiers and now this new lockdown, Basildon Council's never been given the money for dealing with this situation. It's been the county council. Last month, we unanimously agreed to take what money was sitting in the Together for Safer Communities budget to make sure the food banks had money. And we've done that. There was no argument. I think the only argument could have been could we have done it quicker? Could we have done it sooner? How was it cut up? But we agreed unanimously. There was no splitting of hairs. But if we keep setting a precedence of stepping in so Essex County Council can go around their posh and prim and proper places in North Essex and throw around the money that should be going to towns like Basildon to make sure the Saffron Waldens and the Faden Wilds of this world get the cream of the cake while our people go with that. That's not acceptable. And I should be tabling a further amendment once we've voted on this amendment, because if, as we've heard from John tonight, this is not an acceptable situation. This is an organisation is in receipt of in excess of £1 billion. £1 billion of taxpayers' money they spend on services. This is an organisation that is getting the money from the government. How many more times must we have to step into the breach in this time of trouble because the county council doesn't give two hoots about Basildon? So, Sarah,
Chairman.
Yes, Councillor Henry.
Sorry, can we get to the amendment, because it's.
We're going to take.
I'm very.
Councillor Henry, we're going to take the vote on the amendment. Sarah, we're going to take the vote on the opposition amendment, please. I should call that each member. Councillor Golden, how will you be voting?
I'll vote against the opposition amendment.
Thank you. Councillor Henry.
In favour.
Councillor Rimmer.
I'm just a little shocked by Councillor Gordon just then. He can't be bothered to speak on the motion. Can't be bothered to speak on it.
Councillor Rimmer.
Can't be bothered to justify to the residents why he voted the way he did to take food away from them.
Councillor Rimmer, you either vote on this or you don't. So how are you voting?
I'm voting in favour.
Thank you. Councillor Schrader.
In favour.
Councillor Yacoub.
I will be voting against, and I would just like to say that there is just so much irony here. It is the Tory government that has created the need for these.
Councillor Yacoub, if I pull up Councillor Rimmer, I have to pull up you when I'm asking, just to be fair. Sorry, Councillor Yacoub, and sorry, Councillor Rimmer. And I should be voting against. So the opposition amendment has failed. So I wish now to table an amendment following this debate. Is your pen ready, please, Sarah?
Yes.
Right. In the same vein as what this committee unanimously agreed to with the Bain books, that a letter is written to the most appropriate person at Essex County Council, which I believe to be Councillor Louise McKinley, that asking Essex County Council to match fund the 10.5 grand we have placed as a council into our food banks as an additional sum of money. In other words, Basildon will be getting 10,500 more proportionally than any other district or borough in Essex. Have you got that down, Sarah?
Yes. Yeah, so we're going to send a letter to Essex County Council asking them to match fund the 10,500 we place as a council into our food banks as an additional, sum
of money.
Right, thank you. Okay.
Do I have a seconder, please? Councillor Golden seconding. I think they're self-explanatory. Anyone would like to speak on that particular amendment? Or we'll go straight to the vote. Councillor Rimmer.
Look, I think you're just, in reality, I think you're trying to play politics where we had an opportunity to fund this with £23,000. Instead, we're writing a letter, we're kicking it into the long grass when there's an urgent need. I think on an issue like this, members of the committee who just sit there silently, not justifying, not explaining their votes, have a lot to answer for. They call themselves progressives, but all of their voting habits are regressive. They took £2 million away from Pitsea for the Innovation Warehouse, and now they've taken food away from people who are in a vulnerable situation at an extreme crisis point for our nation. And I think they should hang their heads in shame.
Well, I was going to bite your head off there, Councillor, and ever so nicely. Councillor Coop, I think you could do a better job than I. And Councillor Golden.
I think it is extremely ridiculous to be taking lectures from you and your party that has created these food banks in the first place. We've needed people like Marcus Rashford to convince this government that children need to be given free school meals during the time that they're off school. We've
Lucky he wasn't trying to convince you, wasn't it?
Councillor Rimmer, you was owed peacefully in peace and quiet. Councillor Coop, you have the floor,
free
please.
School meals have been delivered, and they have been absolutely ridiculous that we've seen today. Things like carrot stubs and little bits and pieces are being passed as free school meals to children, and you are accusing us of
I'm accusing you of being heartless, yes.
Councillor Rimmer, you get heard with respect. I may disagree occasionally with what you say, but you're always heard with respect. And every member, every panellist on this committee will be heard with respect and no interruptions. Sorry, Councillor.
We have before us a report that clearly shows the funding that we have put into the voluntary sector and to the food banks. We as a council have done more for the people of Basildon than the Conservative group did when they were in power. And it is absolutely ridiculous to hear you make these accusations today. I really think you need to reconsider the party you are a part of and what it stands for before you start speaking on behalf of people who are starving. Thank you.
Thank you. Councillor Golden and Councillor Henry.
Yeah, thank you very much, Chairman. I didn't want to speak because, quite frankly, I'm exhausted because I work in a hospital trying to support vulnerable people who are struggling at the moment. I've been working every hour God sends. So the reason why I might be exhausted and presented a bit tired is because I am exhausted, because I've been doing a job trying to support people. So don't lecture me, Councillor Rimmer, on that, because
Chairman, Councillor Golden.
Because that's disrespectful and it's uncalled for. The second reason why I didn't want to speak is because I didn't want this very important debate to descend into party political petty point scoring. We could have had a mature debate, we could have had an open debate, we could have had a frank debate. And instead we're trading insults from the party floor, and that's not what this is about. I'm very disappointed in Councillor Rimmer, because I could sit here and talk for hours about the policy of the Conservative government and how it's created this need for food banks.
I could talk for hours about how we have votes and you're always missing in action.
Sorry, Councillor Golden.
I think it's very, it's quite baffling to hear Councillor Rimmer accusing me of being missing in action when over the past, or since March, as I said, you know, I've had other priorities in terms of working in a hospital and that's quite needed at the moment, while still providing responses to my residents. I think it's fair to say I am a bit exhausted, but hey ho, that's not what we're debating here today. That's just Councillor trying to make political points. But as I said, I didn't want to sit here and make it into a party political speech, because food banks shouldn't exist in this society. We should have a society where no one goes hungry, where no one has to struggle for gas and electric, and that's the society we should have, but we don't. And I'm a realist. We don't have this society. We are supporting our residents in this town in every way we possibly can. And I just feel I'm very disappointed in Councillor Rimmer that he's decided to make this personal, decided to make this party political. And I think we can all hold ourselves to a better standard of debate.
Thank you, Councillor Colvin. Last speaker, Councillor Henry.
Thank you, Chairman. I too have been working flat out in a clinical environment since March, and I'm acutely aware of the difficulties of poverty-stricken families. I'm acutely aware of what it's like to grow up in poverty. I have grown up in poverty. There was nothing political about the points that I raised or the amendments we raised. I think for the most part, I don't think any of my group disagreed with any of the spending. It's just hard to justify spending money on stuff when, whether we like the reality of food banks or not, they are a reality. And we have a man here who's working his arse off to feed people in our borough, in my streets, in my neighbourhood, and Andrew's ward too. Should he be doing it? No, he shouldn't. We should never have a situation where that. Who caused it? Who cares? It's the situation we're in. I'm not saying that it's our job, and I don't give a bugger one way or the other whether it should be county or it should be central government. What I'm saying is we've got £23,000 here. We can spend it on stuff or we can feed people. That was the choice presented to us. That's all I've asked for. And yet again, we launch into another backwards and forwards, and you poke us and we poke you, and it serves not one bloody person in this borough. It's an absolute joke. Every single meeting turns into something like this. Serves no purpose. Most of our residents couldn't care less. They're just worried about where the next meal's coming from, some of them. They're worried how they're going to make the decision between, being able to keep the phone, which might be an essential communication need, or maybe be able to put extra lights on or put extra heating on. We're all aware of the situation. Some of us have come from that situation. They've had to work very, very hard to get ourselves out of it. And some of us live amongst it every single day. We've all got casework. We've all got to work. We've all got to pay our bills. John stood here saying that he's struggling. He's saying that he'll always be struggling. And I'm not saying that we should be picking up a tab that's somebody else's. Of course, we can write a letter. We could do that without emotion. Really happy to do that. But we've got an opportunity to spend 23,000 once. Once it's spent, it's spent. So we've lost emotion. It is what it is. If you want to write your letter, write your letter. You don't need our say-so and you don't need our vote because you've got your casting vote anyway. So, I'm happy to move it on, but this isn't a political thing. This is an issue. John's a real person. I meet him in my supermarket. He works just behind my house. He's feeding real people, my neighbours, my residents, Andrew's neighbours.
Thank you, Councillor. I know Councillor Cooper wishes to speak again. If I kindly let you speak again, then every other single member will wish to speak again. So fair is fair. Okay, I'm going to put the amendment to the vote and say a few words following this brief debate we've had on it. I'm sorry it's got a bit heated, but we feel strongly on this issue. But the reality is the county council has been given the money from the government to support institutions like the food banks. What are they doing with the money? That is the question. This administration cut the number of special responsibility allowances paid to councillors. This committee was split across two, meaning two special responsibility allowances. It's been merged as housing and communities back into one committee to abolish a special responsibility allowance. That is now helping to feed children during the school holidays. And I think this is why there is this friction. I appreciate and understand what the opposition are saying, and I would urge them strongly to get onto county. Screw Finch, Basildon first. That's how it should be. This is why we want away from Essex. But for the administration members, we have done everything we can without having to be asked. Because we see it, we represent the more deprived wards. I'm not saying Councillor Henry isn't. I'm not saying Councillor Rimmer isn't. But the bulk of the administration members are representing areas of very high deprivation. And we don't need to be nudged. We go out there and we look for them solutions. We look for those answers. So Sarah, I'm going to put my amendment to the vote. So it's all formal and it's got the committee support. There'll be right to, in my name, a letter to Councillor McKinley, Essex County Council, to ask for that additional, to say, we've done it, you need to back up on this borough of high deprivation. Councillor Golden, how will you be voting?
I vote in favour of the amendment.
Thank you. Councillor Henry?
I'm going to abstain, Chairman. Thank you.
Okay. Councillor Rimmer?
Abstain.
Thank you. Councillor Schrader?
Abstain.
Thank you. Councillor Cope?
In favour.
And I shall be voting in favour. So, Sarah, if you can have that letter ready for me tomorrow, and as soon as I've got it, I'll get that, I'll sign it in my name, so to speak, and that's off. So, I'm going to put the 4 recommendations together with the amendments that have passed as one vote. Sorry, John, did you wish to speak?
Yeah. Well, I'm not going to get into the political argument. I just want to read you this. My phone's been off all night, but it's coming through. It's from a lady that got a food parcel this afternoon. She says, I'm absolutely blown away with the generosity of food you give me today. God bless you. And there's about 6 like that. And while we've been sitting here, while your meeting's been going on, I've had 15 requests for food parcels for tomorrow. And I've already got 9 on the list. So I've got another 15 to add to that tonight. So there's your emergency biting you in the backside right now.
Thank you, John. And there was something I was going to add to that. And that's why it's so important the county council delegates and devolves that money to Basildon. Then we don't have this argument we've had tonight. We know where the need is, not where the county council is. And if I can also say before we vote, in the New Year's honour, why John Mackay never got an award amazes me when you look at all the people that was given an OBE, MBE and the lot. Okay, so Sarah, the 4 recommendations and the 2 successful amendments were put to the vote as one block.
Yeah,
I should call each member.
Yeah,
Sorry,
we've got 7 actually. If we count the letter, we've got recommendations 1 to 7. Yeah.
Yeah, so it'll be one block vote.
Yeah.
Okay, Councillor Golden, how will you be voting?
I'll vote in favour of the recommendation, Chairman.
Councillor Henry? Sorry, Councillor Henry, you're muted.
Sorry, I'm muted. Abstain, Chairman. Thank you.
Thank you. Councillor Rimmer?
Abstain.
Councillor Schrader?
Abstain.
Councillor Cope?
In favour.
And I should be voting in favour, so the item's passed. Now, what have we got left? So, as it's a bit heated, and I think everyone could do with a 5-minute break, it is now 9:20, so I shall see everyone again 5 minutes from now at 9:25. Okay? So I'm adjourning the meeting. Everyone have a blow. Get nice and calm. Oh, sorry, Sarah. Sarah? Hello?
Yeah.
We're back in the room. Anybody who's coming on the call? Now's a good time.
I'm back.
Thank you.
Right.
Is that everyone, Sarah?
Can't see Cube just coming on. Yes, that's all of you, isn't
Right.
it?
And is the YouTube malarkey on?
Yeah. I'll start record. Yeah, I'll press the record again for the webcasting one.
Should have put some adverts on, eh? Go to Ken's Fish Bar. 10% discount if you're not a councillor. Right. Okay, so. Okay, members, we're going to the Housing Revenue Account Service Charges. Richard Larkman, are you here somewhere, please?
Yeah, I'm here, councillor.
Thank you.
Hello. Good evening, councillors. Thank you. Councillors will recall that at the November meeting of the committee where the budget and service charges were considered, I said that I was unhappy to bring forward for approval at that time the heating charges and the block lighting charges, because the data, I was unhappy with the data and the information that was giving me. So I said I would bring it back to this committee after we'd done some further work. So we have done some further work on that. We've sorted out some of the data. The charges are now based almost in their entirety on actual charges rather than estimates. So they're grounded. In fact, there's very little element of estimation in these charges. So the heating charges, I won't read everything that's out in the report. So the heating charges that are in enclosure number 2 represent an average 1.7% increase from those levied in 2021. These charges were presented to the Sheltered Housing Focus Group on the 7th of January. They've asked a few questions, which we're going away to have a look at, but none of which, the answers to which would alter the proposed charges here. We also went away to do some further work on the block lighting charges. We haven't included on the agenda a schedule of all the block lighting charges because it's very, very long. But if any member subsequently wanted to have a look at that schedule, I'd be more than happy to send it on to you. Again, we've been able, because we delayed the calculation of the charge, we've been able to base it more on actual readings, etc., with a reduced element of estimation in there. And the proposal represents an average 3 pennies a week increase on the charge that was levied last year. And then also we have proposed that the standing charge that's charged for the Langdon Hills District Heating Scheme and this is the standing charge, so it's not the consumption charge. The consumption charge is based on actuals. That we've proposed that be increased by CPI at the end of December, which was 0.5%, as we consider that represents an appropriate representation of the increased costs that the council's faced in providing that service. So I'm happy to take any questions. Thank you.
Thank you, Richard. Members, who wishes to come in? Councillor Rimmer?
Yes, it was just obviously to understand, there's a couple of things I'd like to say, but in terms of a question, it was just to understand why the heating charges have gone up by 1.7 overall, but the Langdon Hills estate by 0.5%. And just wondering why there was that inconsistency.
And there are different factors at play here, councillor. The heating charges are a measure of consumption, of heating consumption. So it's a price volume calculation. So the volume of heating that's being used multiplied by the price. So that's the factor there, which is why that's gone up by 1.7%. The 0.5% increase in the Langdon Hills, it's on the standing charge, not on the consumption charge. So that's a representation of inflation on our internal costs, staff costs, etc., etc. So that's the reason for the differential.
Councillor Rimmer, did you want to come back?
Yeah, as a sort of follow-up clarification. So to be clear, the people in Langdon Hills estate, in terms of their heating charge on their consumption, it is going up by 1.7%. It's just that there's a standard admin charge that's going up by 0.5% as part of that bill.
No, sorry. Yes, the second bit was right. Yeah, the standing charge is going up by 0.5%. This report isn't seeking approval on the consumption charge. Those charges are dealt with in June every year. So there's no proposal in terms of the consumption charge for Langdon Hills included in this report.
Councillor Rimmer?
Yes, obviously we've had some reports in the media and other people from residents directly in respect of the Langdon Hills heating, and that there have been complaints about it and breaking down, not being able to get hot water, etc. Is this increase really warranted at this time when the service hasn't been 100% and also at a time of hardship?
I think it's for others probably to make that judgment. All I would say is that 0.5%, the Consumer Prices Index, was considered to be an appropriate measure of the increase in cost to the council of providing that service. And the judgment as to whether or not there should be some adjustment in respect of the issues that you've just mentioned, Councillor, is for other people to make that judgment. That certainly wasn't taken into account in this proposal here.
Any other speakers? Doesn't look like there's any. Nice. Good. So the recommendations on page 61, I should call out each member individually and we'll go straight to the vote. Councillor Golden, are you in the room?
Yep.
How will you be voting, please?
I vote in favour of the recommendations, Chairman.
Thank you. Councillor Henry?
Against, Chairman.
Councillor Rimmer?
Against.
Councillor Schrader?
Out of an abundance of caution, I would normally vote against, but as it would seem rather self-serving, I shall abstain.
Thank you. Councillor Yacoub?
I'm in favour.
And I shall be voting in favour of making sure our estates and our heating systems work perfectly, because without the money, they don't work. Thank you, Mr. Richard Larkman. Now, we've got the Housing Ombudsman Service update for Basildon Council. And Leslie, I'm guessing why you're hanging around is for that item.
Thank you, Mr. Chairman. So hopefully you've all had the attachment sent out today that Sarah sent out, because it was rather small in the agenda. So I'm hoping that everybody has sight of that. So this report this evening is just for noting, and just in terms of a little bit of context. So the Housing Ombudsman Service was initially created in 1996 to ensure that disputes are resolved and that residents get the redress where appropriate. There's a number of changes being implemented to the service around speeding the process up, which can take a long time sometimes, and to make access much easier for residents. The key changes are around, and I did include some of this in the briefing paper that hopefully has now been circulated to you on the white paper. But the changes in terms of the Housing Ombudsman is removing the need for residents to go via a designated person. So previously they either had to go to a councillor or an MP or through the tenant scrutiny panel, or wait 8 weeks before they could even take their case to the Housing Ombudsman, which obviously, when people are very stressed and concerned about an issue with their landlord, they really don't want to have to wait that period of time. It just elongates. So that's about to be removed. They've increased the resources, so they've put more staff in place so they can deal with things quickly. and they've been given more powers to take action, and they've also published a complaint handling code and guidance. So in summary, really, the changes are about holding landlords to account, increasing tenants' confidence in the Housing Ombudsman Service, and strengthening the relationship between the Housing Ombudsman and the regulator of social housing. So they need to work much closer together in tandem around consumer standards and regulation. So as the report says, all social landlords must by law be a member of the Housing Ombudsman scheme. And from March this year, the Housing Ombudsman will be publishing details of reports on complaints and individual determinations on their website. And the reason for that is obviously to make it more transparent, but in order for us to learn the lessons really that others have made in terms of some of the landlord services. So in future, the Housing Ombudsman will have power to take more robust action where there's evidence of systemic failing and also a breach of consumer standards. And they've got the potential to refer outcomes of their investigations to boards of housing associations or indeed elected members of local authorities. And I see that as a really good thing. When things start to go wrong, obviously elected members should be hearing about that at the earliest opportunity. So just very quickly, in terms of the data presented in at enclosure 1 this evening, so that shows the inquiries and complaints received over the past 3 years. And for Basildon, that's an average of about 20 cases across all services departments. As you might expect, property services has got the most in terms of individual cases there, and that is obviously, as we know, a very transactional area. In terms of comparison with other landlords, I find it very encouraging that the breadth of categories is smaller in Basildon. If you look at that second sort of the pie charts, that helps from a service perspective. When we look at improvements, it's spread over a smaller area, if you like, and there's lots of areas where we haven't had any complaints. So I see that as a positive. The complaints closed without fault. Sorry, if you go to the bottom of that slide, where you can see there have been 4 cases where there's been a determination, and there's been one case of maladministration and one partial. They were both relating to property services. One was around heating and a radiator, and the other one was a roofing job. And obviously they were determined, and the amount of compensation that's been paid is £950 for that year. I think the lastly on that slide is in terms of time to comply with orders, we're 100% right across the board. So although the numbers are small, we have complied with the timescales on those. So I think that probably concludes the analysis of that. Happy to take questions from members.
Councillor Remote, you have the floor.
Thank you very much. I've got a number of points on this. It's quite a key issue, and I think as a council we should be taking alternative dispute resolution services very seriously, especially this is an area that obviously the government has looked to and has streamlined how each of them work and have applied a consistency. And I agree with Leslie's analysis on this in terms of removing some of the barriers to actually how tenants and can actually complain to the Ombudsman. I wanted to know what we as a council were doing to support them, because we're not the only landlord, in terms of the guidance that we actually offer for actually people who are minded to use the Housing Ombudsman as a form of alternative dispute resolution. So that was one of my key questions. I'm also interested, obviously, in the compensation levels on the 4 determinations that have been had, that equate to £950. When we're talking about that compensation, is that purely the actual inconvenience payment to the people it concerned? Is there also a cost in terms of putting right, which they won't actually pocket themselves? But in particular, you mentioned roofing. There might have been an actual cost to the council in actually putting right the roofing situation in that respect as well. Is this report, I've made an assumption, and apologies because we only got it today in the more clear form, was that this is about our tenants rather than private tenants as well. Is there any sort of comparison how we're doing versus private landlords in the borough? And the fourth issue was, as a council, can we have a target on this or a policy on this? To promote all, guidance and access to alternative dispute resolution, but also a zero complaints target, because we've got quite a low number, but it's been consistently stable, it looks like, in terms of the over the years. And it does feel we could aim for almost perfection on there and go for that as an ambition to have a sort of zero complaints target.
Thank you, Councillor. I'll try and remember all those. I should have written all those points down, shouldn't I? So I think, firstly, in terms of encouraging people and people understanding how they can complain, that's very, very clearly laid out through our complaints procedure and publicised on our website. And whenever we respond to somebody on a complaint, we tell them, if they're not satisfied, how they can escalate that. And as I was saying at the beginning, it's been quite difficult, a long process before people can, if you like, break away from the council responding to that, to go independently to the Ombudsman. And that's what these changes are introducing. It makes it quicker for them to sort of work through the council initial complaint and then be able to escalate it to that independent Ombudsman process. So that I see as a positive. You know, if they're not satisfied with what the council's saying, when they've exhausted our complaints procedure, then they can much more quickly move on to the Ombudsman. So that was that aspect. Yes, it would be lovely. I would be very happy to see zero having gone to the Ombudsman. In some respects, others would disagree with that and say that, you know, things will always go wrong. And if you didn't have anything going to the Ombudsman, people might start to suspect that you are not telling people that they've got that redress available to them, and you're trying to sort of prevent them really from escalating it. So there's two schools of thought on that, really. Fortunately, the numbers are very low, which I'm very pleased about. And I would like to think, through the tenant scrutiny panel and through our own performance frameworks, that we really do learn the lessons when things go wrong. You know, we pick up, they analyse what's gone wrong and make sure that that's fed back in detail to the services. I think with the Ombudsman now actually printing, obviously they'll be depersonalised, but they're actually printing cases, live casework. So there'll be learnings from that as well. I'm sure we'll be able to pick things up from that.
Yeah, there were 2 points. I understand you probably wanted to write them down, but there were 2 points that I covered that you didn't cover. So one was compensation, obviously, was I felt that was for inconvenience payments. What was there a making right financial impacts as well? That was one of the points. And the other point was, how do we compare against private landlords in the borough? And then, okay, you've answered those. I've got a couple more questions.
Okay, Chair. No problem. So in terms of the compensation, there's a very it's laid out like a matrix of what the limits are for each of those different, which I can get those attached to the minutes, so you can have a look at those. They change from time to time, but they're laid out for us as guidance, really, in terms of compensation. And this information is purely social landlords, so I don't have the comparison with the private rented sector. I could hazard a guess, but I shan't do that this evening. But I think we would fare quite well against the private sector.
Thank you, Chair. And obviously you mentioned the Ombudsman's determinations and what we can learn from that, and that's quite key. I think it would be useful for this committee to see determinations report for the whole country, just to a sort of an analysis of what you're learning and things that, because the best will in the world, some of those complaints that might happen in Northampton or Hartlepool might come up here at some point, and it's knowing what our risks are in terms of as a landlord as well, and what we and how we can learn and how we can process complaints, how we can handle things better as well. It'd just be quite key, isn't it, really, and what we can learn from that.
Yeah, completely agree with you. They're not going to start publishing them until March this year. So obviously we need to give them a bit of time to get those on their website, but absolutely, yeah. And we'll have officers drawing those down and sharing them with the relevant officers in the relevant departments. So yeah, completely agree with you.
Thank you, Councillor. Go on, Councillor Rowan.
Yeah, thank you. I do wonder if there's, apologies, it would be good to see the guidance, because I know I've seen the complaints guidance, I think, on our website, and I'm not too sure that I've seen references to the Housing Ombudsman, and I'm not too sure I've actually seen any reference to any outside help that people could actually get in formulating their complaint, because obviously there is a bit of asymmetric information. On our part, we know a lot and the residents know less in terms of the process, how to go about making a complaint, and what's a valid complaint or not, what can be learnt from previous determinations or not. But there are organisations out there that probably would be able to help with that. I'm just wondering what added guidance do we give in terms of that signposting to the Housing Ombudsman versus the local government ombudsman or any parliamentary ombudsman, and also what guidance, what signposting we give to external guidance that could help tenants.
Obviously, at the current time, as I say, it's quite difficult. It's quite a difficult process for tenants to be able to get to the Ombudsman. They have to jump through several hoops before they get there. It is all laid out in the complaints procedure, and it should be on the website as well. But obviously going forward, that would change because it will be easier for people to make those approaches. And what I do hope, they're saying that they're putting extra resources into it. What we do find sometimes that even when people do complain to the Ombudsman, it's not the landlords that are holding the process up. They're providing the data and the information, but the Housing Ombudsman are not able to turn those around quickly enough, and so there's another inherent delay in the process then. So I'm really hoping that that's not the case with this, but I will check the website, but definitely I've signed lots of letters off where we do say, if you're not satisfied with this, it tells them what the next process is. And we have, of course, our tenant scrutiny panel, which plays a similar role to the designated person. So once it gets to that final stage, they will review that case as well. And that's literally everything. That's in a lot of detail, you know, the whole from start to finish of the complaint. And that's our tenants and leaseholders that sit on that panel and do that job for us. So okay. We hope that we're transparent.
And just from an earlier point made in between questions between Councillor Rimmer and Leslie O'Shea, it seems like you've been on here a while, Councillor Rimmer, but I think it was a little over a year ago, prior to you being a regular member of this committee, was this subject of disrepair claims. So we all know of the infamous phrase of ambulance chasing solicitors. Well, this is the no wheeze. They look round for tenants who've not had their repairs done in a timely manner, and they make a disrepair claim. These sort of ambulance chasing solicitors say to the tenants who've had an outstanding housing repair from being their social or housing association landlord, and make a no-win, no-fee type court case against the council. And I think from memory, and I'm sure Leslie O'Shea will pick me up on this, I think there's one council, I think it's Croydon, that's been badly about 20 to 30 claims of disrepair. Well, I think we're, Leslie, about 1 or 2.
Yeah, 2 or 3, I think, yeah.
So that works as well, because the council's of the mindset, we do not want these disrepair claims, because whoever gets the money is the housing revenue account that's paying for the court costs, the solicitor, and the crumbs the solicitors throw at the tenant who wanted a bit of justification. So we've got that as well on our back. Yes, Councillor Rimmer.
No, Mr. Chairman, I'd echo what you just said about effectively these are claims management companies, and they are taking the lion's share of whatever compensation is actually got through the courts or through other means. They might use alternative dispute resolutions services, but in reality, if we're signposting to the housing ombudsman and tenants are going there, then, as you rightly say, they're less likely to use these claims management company. But we've got to be loud and robust about it, because these guys are very personable and will actually make people see the pound signs, as you can appreciate.
Exactly, and this is why they're now becoming, what you said, Councillor, and I don't disagree, I agree with every word. Then this is why these disrepair claims are a real scarer for local authorities. So I would just say to the newer members of this committee, which is yourself, Councillor Schrader and Councillor Coon, is to look into these disrepair claims, because it is costing local authorities a few quid. And unfortunately, as you say, Councillor, the solicitors wave the pound notes around, and you could be struggling for cash, and you think, oh, that might pay for, you know, replace the old banger on the front drive for something they can get an MOT on a regular basis. But unfortunately, time these solicitors have done their bit, they'll be lucky to get a kid's Happy Meal. So, do we have any other members wish to talk about the actual item itself, the Housing Ombudsman Service Report? Good. All right. So this is just for noting, isn't it, Sarah?
Yes, it is. Yeah. So you don't, the committee don't have to vote on it if they don't want to. I would just state that it was noted.
Perfect. It is duly noted. Leslie, you're leading on the COVID-19 impact assessment.
Yes, thank you, Chairman. I'll try and keep this brief and just talk about exception. Obviously, we've now gone into full lockdown again following a period in Tier 4. And in terms of service delivery, there's not been too many significant changes in that. So the homeless service, we've seen a slight reduction in approaches, but nothing significant. In terms of rough sleepers, we've assisted 55 rough sleepers since March. 37 of those are now in settled accommodation, and we have 14 in hotel accommodation. We are still doing house moves, so we're still turning the voids around, and we had a number of mutual exchanges in the system when we went into lockdown, which had already had all the necessary inspections, and we've allowed those to continue. The decision that I have made is ones that have not yet started that process, we've paused for the time being, because although government guidance says that house moves can take place, obviously with the rate in this area and the increased risk on our staff as well as tenants and homes that we're going into, we're very worried if we lose our staff, we won't even be able to do the essential stuff. So we're just pausing it, and we're going to review it in a couple of weeks' time, when hopefully we will start to see the tide turning a little bit on these cases. So I know that's very disappointing for people, but they're not essential moves. They are people who've got a roof over their head. You know, it's just that they want to perhaps go to a slightly larger or smaller property. So that's where we are with those at the moment. In terms of sheltered, that remains the same, with the communal areas closed apart from the laundry. The external communal areas are open, obviously with social distancing in place, so people can go and have a walk outside. We were made aware, or have been made aware, of some issues on sheltered where people were breaching, not complying with the guidelines, and we've had to intervene. And it's been quite a difficult period, I have to say, for some of our staff, in that they've been abused by tenants on schemes where they're not happy that they're being restricted in their movement. So that's been quite a difficult issue to resolve. Rents, no surprise, I suppose we're seeing a progressive increase in rents. We're working very, very closely with Citizens Advice and other partners to encourage tenants to seek advice and get that support as soon as they possibly can. I think I probably reported at the last update that CAB was saying it was surprisingly quiet for them. People appeared to be burying their heads in the sand and not approaching them. And I'm pleased to report that when I spoke to the chief exec earlier on in the week of CAB, she's saying more people are now approaching them and asking them for help. So we see that as a positive sign, but nevertheless, the arrears are increasing. With repairs, we're back to essential repairs only. So that's around health and safety and compliance issues. And again, the message there is about protecting tenants and protecting our workforce, really. And we review that on a regular basis. It's not something we want to do, but we really cannot afford to be increasing the risk at the moment. I think everything else probably remains as it was before. So I don't propose to go into any more detail, but if members have got questions, happy to answer them.
Councillor Schrader, your eyes, I caught your hand first, and Councillor Rimmer.
Oh, blimey, did I beat Rimmer? It's unheard of. Thank you, Leslie. Just wanted to pick up on one thing. You mentioned that we're not doing mutual exchanges at the moment, and if that, well, I think I what I heard you say.
Yeah. So
if that is the case, I was just wondering why, because I know of at least one housing association that is still doing them.
Sorry, I didn't catch that last bit.
I just wondered why we're not doing mutual exchanges, because I know of at least one housing association that is still doing.
Yeah, okay, and I know of others, and I've made that decision. That's what I'm saying. So the guidance says that house moves can still take place, but in order to do it's slightly different when there's an empty property and tenants moving into an empty property that we've had the opportunity to clean, etc. This is a straight exchange between two households. It means our surveyors, of which we don't have many, going into those properties to carry out quite a thorough inspection on a mutual exchange. And so we've just paused them initially for a fortnight, hopefully till the rates start to turn the tide a little bit, and then I'll review it. I know it's disappointing for people, but then we don't consider them to be essential moves at the moment. So it's just to try and manage the infection rate.
Right, Councillor Rimmer, you have the floor, please.
Yeah, thank you. I had a different question, but I really would like to follow up on what Councillor Schrader's question as well, in terms of these mutual exchanges, because he's really uncovered a quite crucial issue, actually, as far as I'm concerned. Because I've got a number of residents who are actually quite hopeful of having something like that. They're looking for properties that are suitable for them. They may have disabilities or other health issues that mean that they actually have to move, or they've got situations with their family where they're in conditions that are not suitable anymore for this, because of the ages of the children in their household, who can no longer share bedrooms, etc. It is that I appreciate that this is under review, and I appreciate your reasons, but it was just a remark from my point of view, and I know I'm not going to change your mind on this, but when it comes to the next review, please can all of this be factored in, because I think there is still a pressing need in the community out there for these exchanges to take place, and we are a large landlord in this respect. I was going to ask, my primary question was going to actually be on the arrears. Because there was an article in the Eye which was talking about how arrears can now be calculated by landlords. But now there's, in terms of eviction, but there was a change. But actually, prior to the change, arrears in the lockdown period since March, since COVID started, couldn't be taken into account. And now arrears since March can also be taken into account. And I'm just wondering if the council has actually taken a policy position on this, not to consider those arrears for that period, or whether it is going to consider those arrears since March 2020.
Yeah, okay. Just to pick up on the mutual exchange point, yes, absolutely. This is a short pause. I've asked officers, will we review it in a fortnight? So that's from last week. We'll review it in a fortnight. You know, if things start to look more favourable with the infection rate, clearly we'll start them again. We don't want to prevent these happening. I understand that people, it's not preventing them, it's postponing them is what we're saying. When we went into the first lockdown back in March, when the guidance was that, you know, nothing moved, nobody moved, they stopped for about 2 or 3 months, and it did cause some hardship. I'm guessing if people have got health issues, They won't want us going in the properties at the moment anyway. And we would always be guided by that. Even if we say we're going to start them again, if somebody is shielding or vulnerable or whatever, we wouldn't want to go in their property. So I hear what you're saying, and I will, based on all the facts, review that in a couple of weeks' time. With regards to the rent arrears, obviously, we took a policy that we would not evict anybody if they built up arrears as a result of COVID. We have got some arrears cases that are long-standing and not related to COVID in any way, shape or form, and officers are very thorough in looking at those. But there is no policy that they will be discounted completely, which I think is what you're saying, isn't it? This is about making sure that people have got the right benefits in place, that if they have got payments to make, that there's a payment arrangement in place that is affordable for them. So that's why we're trying to encourage people to come to us at the earliest opportunity. And interesting, the conversation that I had with CAB this week is around, sometimes we make these decisions for the right reason and give people extra time, but actually what that does is just banks up a problem for further down the line. So it's always that encouraging people to contact us at the earliest opportunity. I hope that answers your question. It's not saying we're writing those debts off. It's saying we will work with the individuals to make sure that they've got an affordable payment plan.
Yes,
right.
Yeah, it does.
Thank you.
Councillor Schrader.
Thank you, Chairman. Sorry, if I could just quickly come back on the mutual exchange stuff, simply because Leslie mentioned Mrs. O'Shea mentioned that she'll be reviewing it. I don't have any housing casework at the moment, but I know it is an issue for other members. And I take on board the explanation that she's given, which makes perfect sense. But as I understand it, a mutual exchange is an agreement between the two parties, and effectively they agree to take the property as it is. So I think what some other housing associations and other providers have done is they've simply dropped the inspections and let the moves carry on. But obviously, if you're wanting to do inspections, I can totally see the point that's being made, and it's not a controlled environment as people are living there. But just to sort of feed it in the mix for when you're considering how you want to proceed. I think what other providers have been doing is just making sure that both parties are briefed, and that how they find it is how they take it, which is sort of the standard mutual exchange policy anyway, I think. But yeah, just something to consider when you're considering your next steps, Mrs. O'Shea.
Yeah, thank you. You cut out on me a little bit there. I think what's been better this time is that officers have been contacting those individuals and explaining to them what's going to happen, why we're pausing them at the moment. Because as you say, secure tenants have got a statutory right to do a mutual exchange, so we can't stop them indefinitely. This is just a short pause, which hopefully won't cause too much hardship, I'm hoping.
Are there any other speakers? Good. I just want to raise one point, but before I do, and I just want to clarify the point. If you're able to pay, but if you're willing to pay but you can't pay, we will help you. If you have no intentions of paying your rent and spending your rent money on big flash screen TVs and designer bag and hand shoes, we will be after you for the money owed. But if you can't pay through no fault of your own, talk to us and we will help you. You have nothing to fear if you work with the council. Now, Leslie, it's been customary when we talk about this tragic subject, particularly now, because I think with the previous 2 lockdowns, you had to scratch your head if you knew someone who had COVID. Now, you start rolling out of names of people who you know have got COVID. I mean, our first mayor of the borough, Mo, she's now fighting COVID. So it's now really on our doorstep. So now this infection is really prevalent in South Essex and the wider southeast of England. What's changed to make our our sheltered housing a lot more safer? Or do you feel they're safe enough? I bring that up just to save a bit down the road any questions being asked.
Yeah.
Islam?
Yeah, sorry, Chairman. I don't think we can do any more in that regard. I'm confident we've followed all the guidelines and we've done everything we can to mitigate the risk to our residents. There's a big responsibility on individual residents living in our shelter schemes to follow the guidelines as the rest of the community, really. So that's a huge plea from me. You know, for people to just take care and to not go into those communal areas and not be going into the neighbours' properties and chatting in the corridors, etc.
Thank you. I mean, else, Mrs. French has been rather quiet tonight. Mrs. French, as a resident of a sheltered housing scheme, can you speak frankly? Look, speak without fear or favour.
Yeah, thank you. We've all here. We've all been following the guidelines, but I do know that there is a lot of people in some of the other shelter places that have not, which is causing more problems because they're not helping one another. They're just causing the issues. Like we've already had a couple of people die of COVID here, and we've had a couple of people who've had an infection of COVID or been tested positive for COVID, but nobody seems to, a lot of people seem to think when you speak to them, oh, it's not really, it's a thing that the government are just putting out and it's not real. I've got family that work in the hospitals and neighbours who work in the hospitals, and they, you know, like they say, you want to go and see it. I would like some people to who turn around and say that they don't believe it, to go to the hospitals and see the actual things that are going on there, you know, because otherwise they're just going to just do what they want. I mean, we're adults, we shouldn't be behaving like kids. And to me, what people are doing is behaving like spoiled little brats, if you like. And, you know, it's stupid. You know, grow up, you know, like you're not a child, you're an adult, behave like one.
And one quick question, Elsie, because I think everyone will be interested, and thank you again for being frank and honest with the committee. What's the name of your dog?
Charlie.
Charlie, do we get to have a proper look at him?
Hold on.
Oh.
There he is.
Get them a rosette and a nomination papers. Thank you, Mrs. French. Councillor Rimmer.
Thank you, Chair. No, it was just minded on what Elsie was actually saying. I'm also thinking of advocacy and community advocacy over COVID, because as we all know, there's quite a bit of a small minority of people who not just misbehaving but become anti-vaxxers, and I just wonder if there's anything that we can do as a council in terms of advocating for people to get vaccinated when their opportunity arises.
I mean, to be fair, Councillor Rimmer, I think when people start to see a friend, a workmate, a cousin fall with this virus, I think the resistance to the vaccine will of course drop. But this vaccine, I can't quote where, you don't need 100% vaccination to deal with this virus full stop. And what will also happen with this virus, it will be like the Spanish flu. So you had the Spanish flu, and then it mutated, and then you get your annual flu. And I am told that COVID will be the same sort of thing. So vaccines and COVID will soon become, in years to come, like the flu and vaccines. Yes, Councillor Rimmer.
I think the danger, Chairman, is if there's a small minority of the community who don't get vaccinated and it's still allowed to exist amongst them, but it could mutate into something else that could be more dangerous and resistant to the vaccine. So there is an imperative, the more people get vaccinated, the better, and the more likely we are to actually beat this. And just thinking, there's clearly thinking about connected communities, thinking about our role as a committee, I think we could do something in that advocacy space to make sure we're promoting people to get vaccinated. and sharing stories about it, sharing stories that put to bed some of these internet myths that are going around that some people believe.
Thank you, Councillor Rimmer. I mean, this virus, if you 100% inoculised everyone, it's going to come back and mutate. But hopefully something a lot more less virulent. But I understand what he's trying to say and set out. But I think the government needs to get the message a lot clearer. Like you say, you know, get people to put real life stories out there saying, I had the injection, it was the Pfizer or this vaccine, this is how I'm doing. But to be added on there as well, Israel's doing very, very well. Most of their population is going to be vaccinated soon because of the politics of the government of Israel to get the vaccines from Pfizer a bit extra. Now, if Israel's thriving, Israel's put COVID behind itself, I think people will be glad to do whatever it takes just to get this virus put to bed and get on with our lives again. Because the annoying thing is you know, he's kind enough to send me kind words about my mother. What my brother's whinging about is we can't have a decent break for my dearly departed mother. And you'd all be very welcome to come along. So sooner we get COVID put out of the way, and get sloshed on yours truly. So,
a toast to that, Chairman.
Oh, not a toast. If it's mum's weight, oh dear, it's sloshed. No short measures, or she'll be back to haunt me. Right, on that item, thank you, Leslie, for the COVID-19 update. And now we've got the work programme. Anyone would like to put anything on there? Sarah's indicated, so we do Sarah and then Craig. Sarah, was you going to say anything?
No, I was just going to say that it's there if there's any questions. I was just having a look thinking I'm not sure we've got any room to put anything more on the work programme. It's so long at the moment when Councillor Rimmer plays hand up. That's what I was thinking. Sorry.
Well, before I bring Councillor Rimmer in, what's the possibility to get through our work line by having 2 meetings in February?
I think we've got an additional meeting now. We've divided it up between February and March. So I think as long as the committee get on with it on the night, we should be able to get through the business. Yeah, it should be fine. Obviously, if we get a couple more or we think it's going to take too long, then we'll speak to you about having an additional meeting. But we have got an additional one for March now anyway.
So we've got, if we was going to have regular AGM in May, we've got 2 more meetings of this committee. Is that right?
Yeah, we've got February. Yeah, we've got February in there and March in there.
Right. And do you think it might be logical to have another meeting in February?
No, I would leave it as it is for the time being. Yeah.
And we can get everything done?
I think we can, yeah. And if we think there's an issue, we'll get back to you, Chairman. But we should be able to. We've had a big agenda today and we've got through it. So it should, we should get through it.
Right. Councillor Rimmer.
Yes, so there's a question and then maybe a request for the work programme. The question was really, I know I had requested and you kindly suggest and said it was fine to have a review of the inclusion and diversity policy, but I'm just wondering, have we implemented some sort of strategy at all? Is it possible a strategy could come along with that report in March for how we actually achieve our policy? Because we do have strategies for the other policies.
Yeah,
that was my sort of question to that.
Yeah, I'm sure there is a strategy. In fact, I'm positive. So Dongay will combine the two, and she'll obviously give an update on progress of actions with the strategy and the progress. So yeah, that will be the strategy will be discussed.
Thank you. And the other thing was, is it possible to have some sort of audit of the sort of community events in regard to our equalities programme, because in how we support different religious events of different communities, how we support LGBTQ plus pride, how do we support Black History Month, and just look at what we do across the borough in respect of that, especially as what we've experienced in lockdown in the virtual world is these events not happening, or they've happened in a virtual way, and it would be good to understand what's happened with them and what we look to do with them going forward.
Yeah, I presume that could, sorry, Leslie, I presume Dungay could include that as part of her report, couldn't she?
Yeah, I was going to suggest that, or perhaps circulate a briefing paper ahead on existing.
Councillor Golden?
Yeah, Dungay usually, when she does her updates on inclusion and diversity, every year that I've been here, that she's done them, she's always included sort of a bit of an update on what events have taken place in the borough, you know, stuff. So I think that usually comes as part and parcel of the update, and I think Dungay has that information to hand. So I would be very surprised if an overview of what events have taken place and indeed are planning to be taken place isn't included on the 16th of March. I don't necessarily think it needs to be a formal audit. I just think Dungay has that information because that's part and parcel of her role. Not sorry if I'm speaking out of turn, but yeah.
Councillor Rimmer?
Yeah, thank you, Councillor Gordon, for that information, and that helps. I was just going to, if it could possibly, and I suspect you'll have this in hand as well, yes, if it could be beforehand, and also whether there could be an aspect of looking at the COVID impact on these events and the sort of post-COVID way to take them forward. Are they going to be hybrid events? Are they unlikely to take place this year and likely to take place on the following year? Just what's the continuity plan, basically?
Okay, Chairman. So before we'll agree to ask Dungay to do a briefing note on that.
Yeah, that's not a problem. Right, is that everything? Right. Good night, members. Before I disappear, if I haven't had a chance, thank you so much for your kind emails about Mother. So thank you so much for that. I appreciate that. She didn't take her too long to go. It was nice and peaceful. Last day before she pegged it, she was sitting there in a sort of comatose in her bed, thinking of her holidays in Austria in the early 70s with her friend Lorraine. She seemed rather happy. But thank you so much, and have a nice evening. And I think we're seeing all each other again on Thursday. Good night. Take care.